What's going on, world? Welcome. Hey, today is Friday. I don't know why I'm singing like that. But hey, welcome, ladies and gentlemen. Y'all already know the deal. Y'all already know what we're doing today. We are going to do some NCLEX questions. So if you guys are just now joining, welcome. I want to know who you are, where you're from, where you're at in your nursing journey. My name is Kevin. Been a nurse for a little bit, but apparently not long enough, I guess. But we're going to be doing NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. And I'm going to do an Ask Me Anything afterwards. What up, Heather? Girl, I see you up in here. Y'all let me know. Y'all let me know what the deal is. Hey, once we get 100 people up in here, you already know the deal, all right? I want to try to get to close to 100 people as possible because that just tells me that this is something that, everybody likes or, people want to keep continuing to see. Make sure you share, make sure you like, and make sure you follow. That's the trifecta that TikTok likes. Who said it? I woke up. Who is that? Is it Keisha? Keisha, you woke up as a LPN this morning, ma'am, in Ohio. Shout out to you. Congratulations, Keisha, for passing the NCLEX, conquering the NCLEX, as I like to say. And welcome to the shit show. Welcome to the shit show of being an LPN. Just now getting in. Congratulations. I'm super proud of you. Maria, Kevin, I passed my NCLEX I took on the 31st. It was my second try. Maria, congratulations. I got 2 people up in here telling me they passed NCLEX. Yo, that's exactly how I love to start my Friday. Everybody, all 13 of y'all, show Keisha and Maria some love. Let them know. Welcome to nursing, RN, LPN. Hey, we're all one team. All right, whether you want to believe it or not, you know what I'm saying? We're all one team. That's the only way we'll be able to get through this, as a profession. So congratulations to you two. Welcome to the shit show. Welcome to it. So, if you guys are just joining, we're going to be doing NCLEX questions. As soon as we get 100 people up in here, I'm going to turn this thing around so you guys don't have to look at my hideous face. And we're going to knock out some questions tonight, and then we'll do an AMA after that. Hey, and if you guys are just here, just now hearing, I have an NCLEX course. It's a 7-day NCLEX course. It's going for $48. Hey, I'm just letting y'all know that on Black Friday, it's going away. It's going away. So if you're looking to get an NCLEX review and course that we're going to be updating here within the next week or so, or 2 weeks, hey, go over there and check it out. You get it $48. You get it for a lifetime. Yes, I said a lifetime. It's not a game. Okay, gonna need that for after Christmas, ma'am. Go over there and check it out. I actually was just reviewing some of my content before I got back on here, or before I got on here, regardless. And it's looking pretty good. I'm doing an NCLEX review. I'm doing an NCLEX review for RNs first, and then I'm doing one for LPNs because I'm going to be doing 2 separate programs. But right now, because that's how I get asked those questions all the time about, hey, do you have one for LPNs? Hey, just to let you guys know, as LPNs, you guys literally learn the same content that an RN learns. Don't ever forget that. The only thing that's different is what you can and can't do, what you can and can't accept. Okay? But hey, we got 118 people in here, but make sure you guys like, share, follow. I'm going to turn this thing around. Guys, listen to Kevin. If you can't afford it, come to his lives. They help big time. Maria, let them know. Tell everybody, they mama, they granny, they bald-headed step dog. All right, I'm done. But hey, shout out to you, Maria. I appreciate the love. I appreciate you letting everybody know that. But here we go, ladies and gentlemen. Here we go. I'm gonna put y'all on a timer, but real quick, before we get stuff popping, make sure you guys participate. Hey, if I have the sniffles, I'm sorry. I don't know what, this Texas weather is something wild. Hey, I'm kind of funny sometimes. Kind of, sort of, but not really, but whatever. Make sure you guys share, make sure you guys follow, and give me all them likes, give me them gifts, give me whatever you want. Don't be selfish your whole life, all right? Hey, if you troll my chat, I'm going to troll you, and then I'm going to give you a 600. A 600 is a ban, and trust me, ask anybody in here, I will ban that ass if you come in here acting a fool, all right? Don't do it. Don't be rude. Hey, I don't gatekeep. I got these questions off nurselabs.com, so go over there and check those out for yourself. Also, I talked about the pre-launch for the 7-day NCLEX course, $48. Go over there, check that out. Link is in my bio. Also, if you need one-on-one coaching, I do that as well. You can check that out in my bio, and we're going to do an Ask Me Anything after that. So until then, let us get it on and popping. So here we go. Question number 1. Let me put y'all on a timer too, because y'all be taking so long. All right, here we go. Question number 1. A 65-year-old man who is a retired professional dancer has been admitted to the orthopedic unit for spinal stenosis surgery. He lives alone in a 2-story house and is concerned about his mobility and self-care post-surgery, given his unique living situation and profession, which has constituted to his current, contributed to his current condition. When should the nurse initiate discharge training and planning to ensure a smooth transition and recovery for this patient? Is it following surgery, upon admission, within 48 hours of discharge, or pre-operative discussion? What are we thinking? What are we thinking? Hey, make sure y'all smash that like button, all right? Hey, last time I think I got to 15,000 likes, something like that. I'm always trying to outdo that like goal, so make sure you guys keep smashing it. All right, we got some people saying D, got A's. We got a B up in there somewhere. Is it Lena? Lena says B. Lena. Hey, by the way, if y'all hear me with my ADHD, that is undiagnosed. Just mind your business and just answer the question, all right? All right, y'all. 15 seconds. I should be an auctioneer as much as I read these. I think D, but also B. Well, Allison, I need for you to just give me one answer. Lovely Mimi, thank you for the follow. And I appreciate the share. Make sure you guys share. Share. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2. Oops, I lied. Just kidding. All right, here we go. And the answer is B, upon admission. Hey, so some of these won't have rationales, and that's okay. But remember, when you guys are studying your questions, always read your rationales, okay? Discharge planning is a crucial aspect of patient care, especially for surgeries that can impact mobility and daily activities. Starting discharge planning upon admission allows for comprehensive preparation, addressing any concerns the patient might have, and ensuring that the patient understands the post-operative care requirements. This proactive approach also provides ample time to arrange for any necessary resources or support the patient might need post-discharge. There's no other rationales, and this comes from health promotions and maintenance. So think about it if you were ever in a position to have surgery, okay? They started right there at the beginning. Hey, who's here to pick you up? Hey, do you have any questions? Hey, let's talk about X, Y, and Z. So that as soon as you get there, that's when the conversation happens, okay? Health promotions, 9 to 12% of NCLEX, okay? On to the next one. I appreciate all the likes. Y'all keep smashing it. All right, here we go. Question number 2. A 5-year-old child has been recently admitted to the pediatric unit following a minor accident at school. The child appears hesitant to engage in play activity organized by the hospital's children life specialist or child life specialist, and frequently asks if it's okay to play with certain toys. The parents express concern about their child's behavior, noting that he was previously very active and curious at home. Based on Erik Erikson's, the psychosocial development stages and the child's behavior and age, the nurse recognizes that the child is primarily navigating which developmental stage? Trust versus mistrust, initiative versus guilt, autonomy versus shame and doubt, or intimacy versus isolation. C is for toddlers, I believe. Okay. Think about the age range, right? Think about that. Discharge education starts at B. What? Ma'am, I think you kind of late on that one. We late. We done already moved on. All right, y'all. All right, cool. Hey, if you guys are new here, we're doing NCLEX questions. I got these questions off nursecollabs.com. Make sure you guys like, share, follow. That's the trifecta that TikTok likes. Okay, make sure you guys do that. Also, I want to know who you are, where you're from, where you're at in your nursing journey. Welcome on this Friday afternoon. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B, initiative versus guilt. Let's find out. Erik Erikson's theory of psychosocial development outlines 8 stages that an individual progresses through from infancy to late adulthood. Each stage presents a challenge or conflict that, when resolved, results in the development of a basic virtue. For a 5-year-old child, the predominant stage is initiative versus guilt. In this stage, children begin to assert their power and control over the world by planning and executing tasks. Success in this stage leads to a sense of purpose, while failure results in feeling of guilt. The child's hesitancy to engage in play and frequent questioning about the appropriateness of certain activities aligns with this stage. This is part of psychosocial integrity. I'm just saying, I have a toddler who's 19 months. And let me just tell you, this dude just thinks he can do everything, whatever he wants. You know, no one even bothers him. We let him pay bills if he could, but he don't. So, but shout out to all y'all. Here we go. On to the next one. Make sure when you guys are doing this, you guys are reading your rationales and you're reading your answers on why they are wrong and why they are right. Okay. That is how you are able to retain all of that information that you're learning. Okay. Here we go. Question number 3. A 26-month-old toddler has been admitted to the pediatric unit following recurrent episodes of temper tantrums and refusal to eat certain foods at home. The parents are concerned and mention that their child has been increasingly assertive, often wanting to do things on their own, like dressing up or using the toilet. They also note moments when the child becomes frustrated and seems ashamed if they can't complete a task. Based on Erickson's psychosocial development stages and the described behaviors, the nurse understands that the toddler is primarily navigating which developmental stage? Everybody's screaming C at me. If you guys are just joining, we're doing NCLEX questions. Got these questions off nurselabs.com. Make sure you guys like, share, and follow the stream. It is super important. It gets out there to people that need it. Okay? That's exactly how you got here, so don't be selfish your whole life. Also, I want to know who you are, where you're from, where you're at in your nursing journey. Brittany, thank you for the follow. Appreciate you. Hey, a little bit about me. I've been a nurse for 3.5 years. I worked in the ICU. I worked in the OR. I work in the OR, and I've worked in PACU. All right. And also, I've been in the Navy for 16 years, was a surgical tech. I've been deployed twice. So got a little bit of experience in my life, just a little bit. What's up, Avery? Ma'am, I ain't seen you in a minute. I'm going to give y'all 10 seconds. It's echoing really bad. I don't know. Anybody else having an echoing problem? Everybody screaming C. Okay. Anybody else having an echoing problem? Brittany from Connecticut and LPN. Okay. Shout out to you. CST to RN. Yes, ma'am. That's what I'm talking about. No, I've been really busy. No. Hello, chat. Okay, cool. Here we go, y'all. Here's our answer. In 3, 2. And the answer is C, autonomy versus shame and doubt. For toddlers, specifically around the age of 2, the predominant stage is autonomy versus shame and doubt. Or did I say, I said guilt at first. I meant doubt. In this stage, toddlers begin to assert their independence by making choices and doing things for themselves. Success in this stage leads to feeling of autonomy, while failure or over-controlling parents can lead to feelings of shame and doubt. The described behaviors of the toddler, such as wanting to do things on their own and feeling frustrated or ashamed when they can't, align with this stage. Psychosocial integrity, 9 to 12% on the NCLEX. Make sure you guys read your questions or read your rationales and read your answers on why they are incorrect. Okay, here we go. On to the next one. Shout out to all y'all. All right, here we go. Question number 20. I'm not going to read the last half because I already feel like this is already too long, but I'll read the first half and then we'll answer it. All right. We have a 20-year-old adult who has been admitted to the hospital following a motor vehicle accident. During the assessment, the patient expressed concerns about their recent breakup and how it might be affecting their overall well-being. They mentioned feeling isolated from peers and struggling with forming close relationships. The patient's parents also share that their child has been distancing from family gatherings and often spending time alone. So based off of that, what is the developmental stage? Everybody's screaming D at me. Hey, if you guys are just joining, 130 plus of y'all, welcome. We are doing NCLEX questions. I got these questions off nurselabs.com, so you guys can go over there and check that out for yourself. Also, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, like, what do you do? Like, what is your occupation? I have always had a lot of PAs in here, some med students, some residents, 20, 30, 40 plus year nurses. We get everybody in here. Had a mechanical engineer in here for some weird reason. Whatever. You do you, boo. But, all right. Shout out to Chicago. Chirac out there. I see you. Medics are better. Maybe. Just started my nursing journey. Okay. Not a nurse. A semi-studying for a chiropractor school. Okay. Shout out to you. Shout out to you, Allison. Just don't be breaking people's backs out there. You know. All right, y'all. Here we go. Tallahassee. Oh, no. Tennessee. I'm sorry. Obviously, I can't read. Tennessee. California, senior nursing student, HCA going to nursing school. Okay, shout out to Amber for HCA, but whatever. Ashanti, I want to be your chick. All right, on to the answer. Here we go. In 3, 2, and the answer is D, intimacy and isolation. Sorry, I just made myself laugh singing Ashanti. For young adults, typically in their late teens to early 20s, the predominant stage is the intimacy versus isolation. In this stage, young adults seek to form close, intimate relationships with others. Success in this stage leads to strong relationships, while failure results in feelings of isolation and loneliness. the described behaviors and concerns of the patient, such as feeling isolated and struggling while forming close relationships, align with this stage. All right. Hey, so sometimes, honestly, sometimes the questions and the answers are that easy. Okay. You literally will find the answers in the question. This is why you always hear me say RTFQ or read the fucking question. You'll hear me say it all the time. 9 times out of 10, you can get the question wrong because you don't read it all the way through or read your answers to try to figure out what the question is asking you. Okay. Psychosocial integrity. All right. On to the next one. Here we go. Question number 5. During a school health fair, a nurse is stationed at the vital signs booth. As students from various age groups approach, the nurse takes their vital signs. Later, while reviewing the recorded data, the nurse identifies one set of vital signs that seems abnormal for the age group. Which of the following vital signs taken during the health fair appears to be outside the typical range for the respective age group? Is an 11-year-old athlete who just got finished sprinting with a pulse of 90, heart rate of, wait, what? Hold on. I'm misreading this. Yeah, pulse of 90, respiratory rate of 22, and blood pressure 100/70. A 13-year-old who mentioned feeling a bit anxious, has a heart rate of 105, respiratory rate of 22, blood pressure 105/50. A 5-year-old who's excitedly running around with friends, 102. 24 and 90/65. This isn't a select all apply, by the way. It's just, you just pick one. All right. So who said F? Oh, F is on there. Usually there's not an F. All right, y'all. What are we thinking? I ain't even going to read the rest. There's so many. Y'all are already reading it anyway. Hey, if you guys are just joining, we're doing NCLEX questions. Got these questions off nurselabs.com. Make sure you guys like, share, and follow. I'm going to push it a little bit closer so everybody can see it. Make sure it's not in nobody's way. All right, here we go. Looks good. Sushi, thank you for the follow. Here we go. All right, cool. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is B, a 13-year-old female who mentioned she was feeling a bit anxious about an upcoming exam. Heart rate being 105, respiratory rate being 22, and a blood pressure being 105/50. The normal range for vital signs for an 11 to 14-year-old heart rate is 60 to 105, respiratory rate of 12 to 20, and a blood pressure systolic being 85 to 120, diastolic being 55 to 80, with a temperature of 98 to 98.6 degrees Fahrenheit. The client's diastolic blood pressure is lower than normal. Both her respiratory rate and heart rate are slightly increased. Well, dang. Yep, blood pressure is low. There it is, right? Hey, so shout out to everybody that answered that question. There's no rationale for this. 9 times out of 10, depending on whatever question bank that you guys have, there will be a rationale. But rationales are the solidifying body when it comes to retaining information, all right? Thank you for the follow, Jessica. Appreciate you. Hey, but real quick, commercial break. We're doing NCLEX questions. Make sure you participate. Give me all them shares, them follows, and them likes. Don't be greedy your whole life. You come into my chat, I'm going to ban you if you start acting like a fool. Nurselabs.com is where I got these questions. So I don't gatekeep. That's where I get them every single time. 7-day NCLEX course. It is in its pre-launch, $48. Check that out. Link is in my bio. It is going away. I'm telling you, Black Friday, it is going away. So make sure you guys jump on that, okay? If you need one-on-one coaching for NCLEX, you can check that out. That link is also in my bio. And we're going to do some questions at the end. So just make sure y'all are here for it. All right, here we go. Question number 6. Does it help to write down rationales? If you're a read-write type of individual when it comes to studying, then yeah, why not? But you got to think, you're going to be studying anywhere from 85 to 150 questions a day. All right. So you're going to be trying to write all the rationales down. You know, you got to know how to compartmentalize and how to, I guess, not doctor script write, but, paraphrase and get down the key things you need. OK, I'm not even going to read this one. I'm going to read it to myself, but I'll let you guys read and you guys drop the answer since I just answered that question. All right, cool. All right, y'all. Hey, if you're just joining, we're doing NCLEX questions. Got them off nurselabs.com. Make sure you guys participate. I want to know who you are, where you're from, where you're at in your nursing journey if you guys are new here. And everybody's screaming A at me. We got some A's, A all over the place. Okay. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is A. Is it Elavil, or Elavil is a tricyclic antidepressant and used to treat symptoms of depression? That is a pharmacological and parenteral therapies question. That is, pharmacology is the second largest section on NCLEX. That was too easy. Hey, may have been too easy for you, but you got to think of like on a broad scale. Some people aren't where you are. However, the questions do get harder, and I'm just letting you know, if questions start to feel very easy, like very, very easy on NCLEX, think about where you are and think about how you're answering them. Because if you start getting remembering and memorization questions on NCLEX, you're probably not doing so well. You want to be at the level where you can apply and use analysis, critical thinking, and clinical judgment. Okay, here we go. Do they usually give generic and trade names? But at the bare minimum, they're going to give you generic names. Like you may not always get the trade name, but you will get the generic name. But usually when you're studying, they'll try to give you both. But I'm telling you right now, on NCLEX, they will drop generic names. Question number 7. A nurse is reviewing the medication list of a 45-year-old male patient admitted to the medical unit. The patient has a complex medical history, including a recent diagnosis of a bacterial respiratory infection, a past episode of Legionnaire's disease, and a family history of, the Campylobacteritis infection, and a long-standing diagnosis of multiple sclerosis. The physician has ordered erythromycin as part of the patient's treatment plan. Which of the following patient conditions would the nurse question the administration of erythromycin? What are we thinking? I'll give y'all 30 seconds on this one. So we're thinking is a recent respiratory infection, Legionnaire's disease, the family history of the the Campylobacteritis, whatever the fuck y'all get what I'm talking about. Is it the MS, the history of atypical pneumonia, or recent exposure to a patient with pertussis? What are we thinking? Everybody's screaming A. We got some folks screaming A. Okay. Hey, if you're just joining, we're doing NCLEX questions. Is it Mackay? Thank you for the follow. Appreciate you. Hey, we're doing NCLEX questions. I got these off nurselabs.com. So make sure you guys like, share, follow. Smash that like button, share, and follow. You never know who's going to need this information, right? Whether it be easy or not. You can never get too much knowledge. I want to know who you are, where you're from, where you're at in your nursing journey. Also, if you're not a nurse, what do you do? All right, y'all. I take it back, not A, but not sure what it is. Hey, I'd rather you guess than not do it at all. You know what I mean? Ultrasound tech, shout out to you. I thought it was F. It could be F. Chicago studying for NCLEX. All right, is it Brianna? Brianna, I see you. Peds RN in Florida. Okay. I'm going to guess B, nursing student. Okay. I got you. All right, y'all. I'm a pre-nursing student, excited and nervous. It's okay to be nervous. Philosophy professor. All right. Shout out to you, philosophy for who's it? The eye doctor right here. It's an antibiotic. Okay. It is. I'm guessing you mean it is the antibiotic. All right, here we go. Here's our answer in 3, 2, and the answer is D, the long-standing diagnosis of multiple sclerosis. Erythromycin is an antibiotic used to treat bacterial infections, including the Campylobacteritis infection, Legionnaire's disease, and certain types of pneumonia. It is not used to treat multiple sclerosis, which is an autoimmune disease affecting the central nervous system. Hey, Kevin, Connecticut here. Shout out to you, user 69. I see you. You got it, Bree. That's what I'm talking about. Badly worded question. I would agree with you. It is a badly worded question. So no rationale for this one. Pharmacology, second largest section on NCLEX. That confused me. So yeah, the questions, like I said, I could give you 100 questions. On NCLEX, they could give you 100 questions, but out of the 100 questions, maybe 10 of them won't make sense, but it doesn't mean that you should fail, right? So if we go through 100 questions, I would still expect at some point for everybody to do well, okay? Here we go. And that's why I say, I always read the question, RTFQ, all right? Here we go. Question number 8. A 58-year-old male patient has been admitted to the cardiac unit following complaints of palpitations and fatigue. Upon reviewing his medical chart, the nurse notes a history of chronic kidney disease and recent episodes of hyperkalemia. The patient describes a variety of symptoms he has been experiencing over the past week. Based on his history of hyperkalemia, which of the following symptoms reported by the patient would the nurse consider unrelated to the acute episode of hyperkalemia? Is it a decreased heart rate, paresthesia, muscle weakness of the extremities, or migraines? What are we thinking? I hate farm. It's so much to know. So the thing about farm is just like once you understand where what family they fall into, most of the families do the exact same thing. Most of them, like on a grand basic scale. Now we're not talking about advanced pharmacology here, right? We're not talking about mastery and doctoral level of pharmacology. We're giving you the basics of the basics when it comes to farm, right? Family names, suffixes do a lot. Like I could like what's an azole? Like where does it fall under? Or what's a prill? What's an LOL? What's a sartan? Like you got to know what family, what body system they fall under, like what family they fall under as well. Okay. It's between Lena says it's between B and D. Lena, got to give me one. Give me one, Lena. Give me one. Jennifer, thank you for the follow. All right, y'all. I can give y'all 10 seconds. Lexi says B. Is it Deanne? Thank you for the follow. Appreciate you. Kathy, thank you for the follow. Appreciate you. A or D? Princess, you got to give me one. Paresthesia. Is it Serena? Okay. All right, here we go. Love, and is it Salem? Thank you for the follow. Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is D, migraines. Hyperkalemia or elevated potassium levels in the blood can manifest with various symptoms, including cardiac disturbances like decreased heart rate, paresthesia, tingling sensation, and muscle weakness. Migraines or severe headaches are not typically associated with hyperkalemia. Physiological adaptation, which is the third largest section on NCLEX of 14%, 14 to 17%. All right. So, like I said, a lot of these, for some reason, a lot of these didn't have any rationales when I was going through them, and me and somebody else were going through them. So we were just like, I'd rather give you guys something than nothing. But it's still important that, hey, if you don't know something, you have to take the extra mile to do the research for yourself. Okay. I hear a lot of people say, well, they didn't give me a lot. Okay. Well, what did you not do in order for you to really understand? Like you got to go and you got to take that extra mile. All right. So you can learn what you need to learn. Everybody else got their license. If that's what you're trying to do, you got to make it happen. Got to make it happen. Here we go. Question number 9. A 42-year-old female patient with a known history of type 1 diabetes presents to the emergency department with complaints of fatigue, increased urination, and difficulty breathing. The nurse suspects an acute episode of ketoacidosis or diabetic ketoacidosis based on the medical history and current symptoms. As the nurse continues the assessment, the patient describes various symptoms she has been experiencing over the past few days based on her potential acute ketoacidosis. Which of the following symptoms reported by the patient would the nurse consider atypical? Atypical, right? Keyword atypical. Y'all tell me what that means down there for those that don't get it for this condition. Is it a persistent nausea leading to an episode of vomiting, a insustainable oh my God, y'all got what I'm saying, feeling of thirst despite drinking large amounts of water, a noticeable increase in weight over a short period, or distinct fruity odor of her breath? Atypical, not typical. Yeah, not expected. Yes. All right, doctor. Who is that? Dr. Awesome? Is that what your name is, right? Awesomer. We got you. You got to remember, some people are just like, I don't know what that means. So not normal for presenting disease. There you go. Thank you, Ashley. Appreciate you. Neil, thank you for the follow. A PT student here. I think it's C. Okay. Shout out to you, PT, physical therapy. I got you. Hey, I just want to let you know, if you're going to go do physical therapy and you mess some stuff up, you better fix it. You better go back in there and fix it. Just letting you know. All right, y'all. 10 seconds. Everybody screaming C and D. Okay. Got some C's, got some D's. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurselabs.com. You guys go over there and check them out for yourself. I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, where are you? Are you a doctor, like Dr. Awesome? All right. Or you got PT student, like, who was that? Ashley, I think, said that. All right. Here we go. Here's our answer. Here is our answer in 3, 2. And our answer is C, the weight gain. Diabetic And that's that's what it's boiled down to. All right. Fruit breath is a key manifestation. Indeed, it is. Cassandra. Can I call you Cassie? I'm going to call you Cassie. I'm going to be like, what up, Cass? Shout out to you for getting that answer right. Studying to be a CNA, just the beginning. Lainey, I know that's right. Here we go. On to the next one. Shout out to everybody that's in here. Appreciate everybody's participation. Here we go. Question number 10. A 28-year-old male presents to the emergency department with a sudden onset of a severe headache, a neck stiffness, and confusion. Look, some of these words, they're just key. They stick out. All right. They just stick out. So there, just do it. You know what it is, right? His roommate mentioned that the patient has been complaining of flu-like symptoms for the past few days. Given the patient's presentation and the information provided, the nurse suspects acute meningitis. As the nurse continues the assessment, the patient, though disoriented, tries to describe some of the symptoms he has been experiencing. Based on the suspicion of acute meningitis, which are the following symptoms reported by the patient, would the nurse consider not expected for this condition? A sudden increase in appetite over 24 hours, episodes of vomiting, especially in the morning, high fever and chills, sensitivity to light, preferring to stay in a dark room. Is it muscle aches and joint pain or ringing in the ear? What are we thinking? Shout out to all 200 of y'all in here rocking with me. We are doing NCLEX questions. Somebody said I'm a biomedical science professor here. I say A. Trenton. All right, sir. All right. You say A. A and F. It's not select all that apply, Jacqueline. It's just one or the other. But shout out to all y'all that are in here. Welcome. We are doing NCLEX questions. Thanks, random account. I appreciate the follow. We're doing NCLEX questions. Got them off nurselabs.com. If you guys want to go over there and check those out, they have a lot of questions over there. So go check them out for yourself. I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, like the good doctor and like the good biomedical professor in here, what do you do? How much is what? Nurselabs.com is free. Everybody's screaming A at me. Everybody's screaming A. OR nurse lab. Okay. Hey, shout out to all my OR nurses. I work in the OR. I do circulating and I'm a scrub nurse. I used to be a surge tech. Well, I'm technically still a surge tech according to the Navy. So I'm a teacher, but thinking about becoming a nurse. Claire, if you're going to think about becoming a nurse, you might want to think about what type of nurse you want to be. Think about what type of nurse you want to be, because not all nurses are built the same. Larissa said, I'm a PA. Shout out to all my PAs out there. Mental health nurse, psych nurses. So y'all be out there ready to fight. I know y'all can throw hands. I know that's what's up. I'm doing my LVN program in 9 days. So nervous. Don't be nervous. Don't be nervous. I'm Navy too, but you're a Mastered Arms. Okay. Is it Dana? All right. Shout out to all my MAs out there. Mastered Arms Security Forces. Bang, bang, shoot them up. All right, here we go. Here we go, y'all. Here's our answer. In 3, 2. And the answer is A, sudden increase in appetite over the past 24 hours. Y'all, this is extremely long, and that is extremely tiny. And I already know that maybe some of y'all can't see it. So I'm going to try my best to read this. I'm not even going to read the whole thing, but y'all get the gist. A loss of appetite would be expected, not an increase of appetite. Most cases of meningitis are caused by an infectious agent that colonizes or establishes a local infection somewhere in the host. Potential sites of colonization or infection include the skin, nasopharynx, the respiratory tract, the GI tract, and the genital urinary tract. Yeah, that's a lot. I'm not going to read the whole thing. Y'all already know what the deal is. All right. Good luck to all those taking the NCLEX. Hey, shout out to everybody that's going to be taking the NCLEX. All right. Hey, I just want to let y'all know I took the NCLEX 3 times. Y'all heard me right. I took the NCLEX 3 times, right? So I am a testament or a testimony or whatever the fuck you want to call it to letting y'all know, like, hey, don't nobody give a fuck how many times you take that exam. As long as you take it, you pass, and you go out there and you do good shit. All right. Hey, real quick, we are doing NCLEX questions. Make sure you guys like, make sure you guys share, make sure you guys follow. All right. Participation is the key, baby. I'm kind of funny sometimes, whatever. Like, share, and follow, because that's the trifecta that TikTok loves to see. All right. Don't be selfish your whole entire life. All right. Don't come into my chat trolling me. If you troll me, I'm going to ban you. That means I'm going to ban that ass. I'll give you a 600. If you don't know, you better ask somebody. All right. Nurselabs.com is where I got these questions. These questions are free, y'all. They are free off nurselabs.com. Go over there and check them out. 7-day NCLEX course. That is my course that I created. Right now, it is $48, and it is going away on Black Friday. I'm telling you right now, it is going away. So if you want it now and you want everything that's getting updated and uploaded into it over forever, link is in the bio. Check that out. Also, if you want one-on-one tutoring for the NCLEX, that link is also in my bio. And we're going to do an Ask Me Anything after this. All right, so y'all can ask me anything. Please wait. What you mean, please wait? Time to go. Is it Makai? We wait for no one. We stay pressing on over here. You feel me? All right, here we go. Question number 11. A 31-year-old patient presents to the outpatient clinic with complaints of red, itchy eyes with a yellowish discharge for the past 3 days. She mentioned she recently returned from a trip abroad. The nurse, upon reviewing her medical history, notes a previous episode of conjunctivitis last year. Given the patient's presentation and travel history, the nurse suspects a bacterial cause from the conjunctivitis, which is the following microorganisms based on the patient's symptoms and history is most likely responsible for her current condition. All right. What are we thinking? This is so irrelevant to RNs. It's not irrelevant. It's not irrelevant for the test though. So thank you for the rose, by the way, Pivot Kane. I appreciate you. However, it's not irrelevant for the test. And irrelevant for in real life? How many times will you see this pop up? Unless you're like working in a clinic or something like that. No idea. So maybe see. Hey, I would rather you. No, you didn't. Oh, okay. I would rather you guess. Because when you guys are studying for your exam, any exam in nursing school, but especially for NCLEX, you're not going to know everything. And that is okay. That is the purpose of having these hard questions, because it allows for you to read your rationales, understand why you got it wrong, do a little bit further research so you can further understand it, and then go on about your day. All right. Nurses don't need to know about the microorganism. I'm a doctor. That's silly. They test you on that. Look, it ain't everybody has to get a basic somewhere, everybody has to get a basis somewhere. So, do they need to know the microorganisms? Probably not. It depends on the level of nurse. I mean, you got nurses that do work in the lab, or you got nurses that do other things. So they'll give you that broad aspect of it. Whether we like it or not, it's fucking there, So, but I appreciate the dialect though, because there's a lot of things I see on here and I'm just like, who the hell put that on here? And why would anyone agree with that? So I'm picking up what you're putting down. Hey, real quick, we're going to go on to this answer. We're going to go on with this answer. I know it's a terrible question. I know, y'all. I'm sorry. Heather, don't do that to me. Don't do that. All right, here we go. And the answer is D. So what is it? A HEA is a causative agent of acute and often purulent conjunctivitis, most commonly known as pink eye. Ew to all you nasties that like to just leave stuff on pillows. Anyways, the other microorganisms listed are associated with different diseases and are not typically responsible for conjunctivitis. Physiological adaptation, that is the third largest section on the NCLEX. The biggest thing about it is that if you do not know the answer, when you are studying and you're reading and reviewing your quizzes, that's the time where you have to go and you have to do further research, and that's where you retain the information as you study it. That's the whole point of seeing hard questions. Instead of being pissed off at them and saying that you don't like them, who cares if you don't like them? You gotta study to the test. Miss Mendez, thank you for the follow. Appreciate you. All right, here we go. Question number 12. A 45-year-old patient presents to the outpatient clinic with a complaint of intermittent joint pain, fatigue, and cognitive disturbances. She recalls having a rash resemble a bullseye a few weeks ago after a hike trip in a tick endemic area. The nurse, upon reviewing her medical history, notes a recent diagnosis of Lyme disease. Given the patient's presentation and history, which of the following microorganisms is most likely responsible for her condition? And these are questions that you would usually see probably like in foundations or like med-surg, But hey, they're still there because guess what? NCLEX covers everything from foundations, fundamentals, basic care, all that stuff, all through nursing school. Educated guess A. Okay, Lena, I see you out there. Shout out to all 210 of y'all. We are doing NCLEX questions. I got these questions off nurselabs.com. All right, make sure you guys make sure you guys share, and make sure you guys follow. Those three things are so important. They're so important. All right. Don't be greedy your whole life. And if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Are you a good doctor, like the doctor that was just in here? Are you a biomedical instructor or professor? Let us know. My micro teacher would be disappointed, but I don't remember. So D. That's okay. That's okay if you don't remember. That's why this is practice. Practice. Hey, professional quarterbacks don't make good throws all the time. Receivers don't catch the ball all the time. Running backs fumble the ball all the time. It happens. It happens. You learn from those mistakes. You learn from those, okay? Brooklyn. Shout out to Brooklyn. Marcy Projects. I don't know nothing about Marcy Projects. I watch way too much Chappelle Show. All right, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is B. Lyme disease is the most common vector-borne disease in the United States. Lyme disease is caused by the bacterium Borrelia, the Burge dorfrei, and rarely the Borrelia mayonnaise or mayonnaise, whatever. I haven't seen these since I was in school. All right, so look, a lot of these I'm just like, sure, whatever you want, bro, whatever you want. Physiological adaptation. All right. Third largest section on NCLEX. People don't realize that it's a lot about using reasoning skills to narrow down your options. 100%. It's about applying what you know versus applying what you don't know. Because trust me, there's going to be those times where you don't know the answer. Shout out to Pittsburgh. All right. There's going to be times where you do not know the answer. Okay, cool. Well, let's apply what you know so you can apply it to the question and the answers. Okay. Yeah, process of elimination. Exactly. Based off of what you know, right? So here we go. Question number 13. A fragile 87-year-old female has recently been admitted to the hospital with increased confusion and falls over the last 2 weeks. She is also noted to have mild left hemiparesis. Which of the following test is most likely to be performed? Is it a CBC, an ECG, a thyroid function test, or a CT scan? And I know somebody's going to be like, oh my God, Kevin, this question is easy. And I want to be like, oh my God, it may be for you, but not for other people who have not been to that level or even been to that spot that you've been at. Okay. I'm interested in tutoring. Ma'am, if you're interested in tutoring, go ahead and go to my link in my bio and then click on the NCLEX one-on-one tutoring, and that'll give you that info that you need. D, thank you for the follow. Shout out to all 270 of y'all. I want to know who you are, where you're from, where you're at in your nursing journey. Right now, we're doing NCLEX questions. Got them off nurselabs.com, which is a free platform. So you guys can go over there and check those out for yourself. Addison, thank you for the follow. All right, here we go, y'all. Here we go. Here's our answer. Third semester, first semester. Okay. Lena, why you say my name like that? I feel like I got yelled at. Shout out to Jamaica. User 14. I see you all the time. Shout out to you. Here we go. Here's our answer in 3, 2. And the answer is D, CT scan. CT scan. Nurse practitioner school. Shout out to you, ma'am. The CT scan will be performed for further investigation of the hemiparesis. Non-contrast CT scanning is the most important used form of neuroimaging in the acute evaluation of patients with apparent acute stroke. Right? Second year nursing student. Where she hurt on her body? On her head. She fell multiple times. All right. Especially her head. There you go. First semester senior in BSN RN. Okay. Shout out to you. Is it Danae? Danae. Danielle says, I'm in my third semester, not in school anymore. Was in my third. Danielle, why? What happened? RN for 12 years. Shout out to you, Erica. All right, here we go, y'all. Here we go. I was about to drop the answer. What is this? 85-year-old male has been losing mobility and gaining weight over the last 2 months. The patient also has the heater running in his house 24/7, even on warm days. Which of the following tests is most likely to be performed? CBC, ECG, thyroid, or CT scan? Dayton. Is it Dayton? Like Dayton, Ohio? RN needs to take the test. Okay. All right. Everybody screaming C at me. Anemia. All right. Hey, shout out to all 300 plus of y'all in here rocking with me. Listen to me run my mouth. Welcome. We're doing NCLEX questions. What's up, Big Mike? I see you out there. We're doing NCLEX questions. Got them off nurselabs.com. All right. I want to know who you are, where you're from, where you're at in your nursing journey. And make sure you smash the like button. Make sure y'all share. Make sure y'all follow. We got 300 plus people in here. There should be no reason why we ain't at 20,000 likes. There should be no reason. You want to know why? Because you're being greedy. Smash the like button, y'all. Smash it. Is it Sadie? Thank you for the follow. Appreciate you. Hypothyroidism. Okay. Somebody said anemia, so that's not a bad guess either. Hyper or hypo. I don't know. Nor you tell me. What's the difference between hyperthyroidism and hypothyroidism when it comes to signs and symptoms that a patient can display to you? Carly, thank you for the follow. Here we go, y'all. Here's our answer in 3, 2. And the answer is thyroid function test. Weight gain and poor temperature tolerance indicates something may be going wrong with the thyroid function. Thyroid function tests are designed to distinguish hyper and hypothyroidism from the euthyroid state. To Accomplish this task. Direct measurements of serum concentration of the two thyroid hormones, which is T3 and T4, are most commonly known as thyroxine. Are extensively employed. Sorry, the NCLEX is like the medical board. Yeah, so essentially it is the board certification exam, or the board certification or licensing exam for nurses to practice in the United States. So LPNs, LVNs, and RNs. All right. Hey, but shout out to y'all. Shout out to y'all. Reduction of risk potential. Okay, reduction of risk potential. Here we go. Question number 15. Shout out to all y'all. It says, question, brother, if doctors are the only ones who can diagnose, how come nurses need to know this? Because you need to be able to, because there's a thing that's essentially it's called checks and balances, right? So if the doctor diagnoses a patient and then they want to try to give you medical orders based off of whatever's going on with the patient, it is a nurse's job to check those orders to make sure, hey, based off of this, I don't know if we should do it's a checks and balance thing. I'll go in when we do the AMA. I want you to ask that question again. I'll be able to give you more detail. Okay. And Canada as well as Australia and New Zealand. Yeah. Leanne, you are very much correct. Here we go. Question number 15. A 20-year-old female attending college is found unconscious in her dorm room. She has a fever and a notable rash. She has just been admitted to the hospital. Which of the following tests is most likely to be performed first? Is it a sugar test, CT scan, blood culture, or arterial blood gas? Welcome. Hey, appreciate y'all smashing that like button. Y'all keep smashing it. I'm telling you, smashing that like button and sharing and following are the three trifectas for TikTok, right? The trifecta for TikTok. That's what I call it. We got these questions off nurselabs.com. Nurseslabs.com. All right, this is free questions. You guys can go over there and check them out. I want to know who you are, where you're from, where you're at in your nursing journey. See, meningitis comes to mind. Okay. All right. Fever gives it away. Okay. Claudia and Langley, thank you for the follow. All right. Let's see what we got. C comes to mind with the fever. Okay. All right, Miss Geeky Girl Art. All right. Okay. All right, here we go, y'all. Here we go. Here's our answer. All right, here we go. Sepsis. All right, let's see what's up in 3, 2. And the answer is C. It is a blood culture. Blood cultures would be performed to investigate the fever and rash symptoms. A blood culture is a test that checks for foreign invaders like bacteria, yeast, and other microorganisms in the blood. Having these pathogens in the bloodstream can be a sign of blood infection, a condition known as bacteremia. A positive blood culture means that there's bacteria in the blood. So yeah, we're thinking of something septic, right? Thinking of somebody being septic, got the nastiness floating around in that blood and we don't want it there. So we got to fix it. All right. Don't love this question. Hey, don't matter if you love it. Don't matter if you hate it, but you got to answer it, because if you get a question like this on NCLEX, you're going to be like, I hate this question. What you just going to do? You ain't going to answer it. Come on, user 52. Come on. Cassandra, thank you for the follow. Appreciate you. All right, y'all. A reduction of risk potential, right? 9 to 12% on the NCLEX. All right. Think about that. Here we go. Hey, real quick, commercial break. We're doing NCLEX questions. Make sure y'all like, share, and follow. Do that right now. Do it now. Do it now. Stop being greedy. All right. I want all them likes. I want all the follows, and I want all the shares. Participation is the key. That's what keeps this thing rolling. Hey, don't troll my chat. If you troll my chat, I'ma ban that ass. That's what it says. Okay. So don't do that. Don't be that person. All right. Nurselabs.com. I don't gatekeep. This is where I got these questions from. All right. So shout out to y'all. I want y'all to go over there and check them out for yourself. 7-day NCLEX course, $48 right now. All right. I'm telling you right now, go over there and check that out if you guys need it. We're updating stuff. I'm working on reviews. You name it, it's coming up there. But for $48, name another review you can get for $48. I'm just letting y'all know. And if you want one-on-one tutoring, you can check that link out in my bio as well. Also, I'm doing an AMA after this. You know what I'm saying? Ask me anything, within reason. Don't be weird. All right, here we go. Question 16. Which behavioral characteristic describes the domestic abuser? Is it alcohol, overconfident, high tolerance for frustration, or low self-esteem? Is Nurse Achieve good? I personally have never used Nurse Achieve. Is your NCLEX review similar to how you do this? Langley, it is very similar to how I do this, but I do go into a lot more detail. My content videos are a little bit different though, because I have like music on there, and I have a couple of quick edits, a couple, some notes and stuff like that to kind of, keep it in the mode of studying, and I keep it under 30 minutes, because who the hell wants to sit and watch a video for 3 hours talking about a subject? Don't nobody want to do that. They usually B or D. Okay. Mitchie. Is it Mitchie or Mishi? I'm gonna mess that up. All right, y'all, here we go. 10 seconds. 10 seconds I'm going to give y'all. Alcoholic, most likely to be aggressive. Okay. Ice latte, like latte from like Starbucks. Not Starbucks. I'm a physical therapy student, but here anyways, it's definitely the, all right. Is it Smalley Molly? Oh, that's an awesome name. I'm even gonna lie to you. Here we go. Here's our answer, y'all. Here is our answer. Hey, real quick. Hold on. Y'all see it right here. It says, see my follow with the flames. You already know what's coming. Y'all know what I'm doing. Who can guess what I'm doing? You already know. You already know. Hold on. All right, here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is D, low self-esteem. Batterers are usually physically or psychologically abused as children and or have had experiences of parental violence. Batterers are also manipulative, have low self-esteem, and have a great need to exercise control or power over partners. Thank you guys for all the shares. Who gave me 2 roses? Is it Data? Thank you. Geeky Girl, appreciate the follow. Thank you. Damn, should have went with the first answer. That's another thing. Do not switch your answers, right? 9 times out of 10, if you switch your first answer is your gut feeling is the right one. Okay, don't change them. I'm cybersecurity major, but this is good info. Is it Shazi? Okay, shout out to you, Serena. Thank you for the follow, Jesse. Thank you for the roses. I appreciate you. But don't change your answer. Stay with your gut. Usually, your intuition is usually the correct answer. Okay, here we go. Question 17. The nurse is caring for a client with a long leg cast. Hey, paint the picture for yourself when these questions are like this, okay? During discharge teaching about appropriate exercises for the affected extremity, the nurse should recommend what? Isometrics, range of motion, aerobics, or isotonic. What are we thinking? Dr. Awesome says, wait, what did you say? Yeah, it went so fast. Says D. Okay. Hey, shout out to all 400 plus of y'all up in here. We're doing NCLEX questions. I got these questions off nurselabs.com. Go over there and check them out. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. I'm going to say it all the time until y'all I'd rather see hearts going up on the side of this, arrows going up on the side of this than it not happening at all. All right. So make sure you guys are doing all that. Also, I want to know who you are, where you're from, where you are at in your nursing journey. Are you not a nurse up in here just, hanging out with us? So I want to know. Appreciate all the follows. Isometric. All right. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A, isometric. Hold on. Okay. I had to make sure I read that right. The nurse should instruct the client on isometric exercises for the muscles of the cast extremity, i.e. instruct the client to alternatively contract and relax muscles without moving the affected part. Right? That's part of health promotions and maintenance, right? Good to know. Somebody said, dang it. Hey, did you change your answer? You're like, yes, sir. Miss Independent, thank you for the follow. Going back to school for RN. Shout out to you. Was a CNA at a nursing facility, then came home health, hospice, aid. Hey, y'all be careful. Hey, for all my people that do home health, I don't know if you guys have read the stories that have come out where these home health nurses have been getting, unalived. In these places, you guys be careful when you guys are doing that. All right. People don't got no respect for nobody, and they definitely don't give a damn about nurses. So I want for y'all to be out there, and I need for y'all to be safe. All right. So just you got to take care of yourself before you take care of anybody else. Don't be letting people play with y'all like that. All right. Y'all stay vigilant, stay frosty out here. Here we go. Question number 18. A client is in her 3rd month of her first pregnancy. During the interview, she tells the nurse that she has had several sex partners and is unsure on the identity of the baby's father. If we call Maury, let me stop. Which of the following nursing interventions is a priority? Hey, by the way, don't ever say that to anyone. If you're a nurse, don't you ever say that to nobody. Is it A, counsel a woman to consent to HIV screening, perform tests for sexually transmitted diseases, discuss her high risk of cervical cancer, or refer the client to a family planning clinic? Not Maury. I know, Shazi. I'm out of pocket. I'm sorry. Shout out to all 500 of y'all up in here. We're doing NCLEX questions. I got them off nurselabs.com. Nurseslabs.com. Free stuff. Go over there and check them out. All right. Also, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, let me know who you're from. We are, doing some really good dialogue down there in the comments. Okay. Also, like, share, and follow. That's the trifecta that gets this to people. Okay. It gets it to people. Don't be greedy your whole life. Give it all to me. You know what I'm saying? All right, y'all. Here we go. Here's our answer. Shout out to Florida. Shout out to you. Is it Kathy? Okay. Jalissa, or is it Yalissa? Thank you for the follow. Appreciate you. Here we go. Here's our answer in 3, 2. And the answer is A. Counsel the woman to consent to HIV screening. The client's behavior places her at high risk for HIV. Testing is the first step. If the woman is HIV positive, the earlier treatment begins, the better the outcome. Reduction of risk potential. You refuse? You refuse what? What you mean? You refuse to what? Get an HIV screening? That's wild. Why would you do that? The answer was in the question. Snuggles. It was. Denver Senior. Okay. Isn't that already done? I didn't say that. Did it say that it was already done? Hey, remember, when you guys are reading questions, don't put anything in there. There is no what ifs. Okay. Don't what if. If you what if, you can get the question wrong because you're going to be like, oh, well, maybe they mean this. Nope. They mean exactly what they have in there. Okay. That's another reason why. That's another reason why I like the case studies that are in the NCLEX now, because they give you all the information you could ever need. Okay, here we go. Question number 19. A 16-month-old child has been admitted to the hospital. As the nurse assigned to this child enters the hospital room for the first time, the toddler runs to the mother, clings to her, and begins to cry. What would be the initial action by the nurse? Arrange to change client care assignment, explain that this behavior is expected, discuss the appropriate use of timeout, or explain that the child needs extra attention. Everybody's screaming B at me. Okay, cool. Hey, if you are new here and just joining, we are doing NCLEX questions. I got them off nurselabs.com. All right, nurselabs.com. All right, I want to know who you are, where you're from, where you're at in your nursing journey. Also, make sure you guys like this stream. Make sure you guys share the stream. Get it out there to people, and make sure you guys follow, because I do these TikToks every Monday, Wednesday, and Friday at 5:30 Central Standard Time or Texas time, whatever. Bro, why does everybody want me to buy their nudes? Why would I buy nudes, bro, when you can get them for free? What's wrong with y'all? I mean, what? Don't do that. We're better than that. All right. Naomi, thank you for the follow. Answers seem very obvious. The answers may be very obvious, Tommy. They may be, right? Here we go, y'all. Here's our answer. Lexi, thank you for the follow in 3, 2. And the answer is B. Explain that the behavior is expected. During normal development, fear of strangers becomes prominent beginning around age 6 to 8 months. Such behaviors include clinging to parents, crying, and turning away from the stranger. These fears or behaviors extend into the toddler period and may persist into preschool. This is part of psychosocial integrity. I believe it's 6 to 12% on the NCLEX. The website is nurselabs.com. So, yep, there you go. Thank you, Chai or Shy. I appreciate you. Texas, US, or us, or Texas, us. Thank you. Hey, shout out to Texas. Hey, I don't care what none of y'all say. I'm an RN from Vancouver. Shout out to Canada. Okay. You know what I'm saying? Shout out to y'all. Hey, where's everybody from? I had some people in here from Nepal, like where Mount Everest is at, y'all. That's wild to me. That's wild. All right. Had some people from Australia, from New Zealand, from South Africa. You already know about it. Shout out to VA. I see y'all prepping for RN. All right, cool. Oklahoma, ill. I mean, shout out to you. I'm just playing. I don't mean that. Hey, go Horns, even though we lost, but whatever. Question number 20. While planning care for a 2-year-old hospitalized child, which situation would the nurse expect to most likely affect the behavior? Strange bed and surroundings, separation from parents, presence of other toddlers, or unfamiliar toys and games. From the Philippines, hey, I'm not even gonna lie to you. I want to go to the Philippines, like just to visit, just to go hang out on vacay. Shout out to all 400 of y'all in here rocking with me. Somebody said, hold on. He says, look, I can't blame you. I was born here and I want to leave. Ma'am, then leave. Kelsey says easy. What you mean easy? Like, you going to give me the easy answer, or are you just going to say easy? CV, thank you for the follow. Hey, we got these questions off nurselabs.com. These are free questions. Nurselabs.com. All right. I want to know who you are, where you're from, where you're at in your nursing journey. A little bit about me. I failed my NCLEX 3 times, y'all. 3 times. I'll tell y'all that story if y'all want to know about it, or y'all can check it out on my YouTube, whichever. Here we go. Here's our answer in 3, 2. Is it blank? Thank you for the follow. Kevin, go to South Africa and go out for vacation. You'll enjoy it. It's on the bucket list. It's on the bucket list, King. Here we go. The answer is B, separation from parents. Separation anxiety is most evident from 6 months to 30 months of age. It is the greatest stress imposed on a toddler by hospitalization. If separation is avoided, young children have a tremendous capacity to withstand other stress. This is psychosocial integrity. One of the smaller sections on NCLEX, 6 to 12%, but it's still very, very important. Let's just say you're not doing well on pharmacology and they start giving you more questions like this. This right there can set you over the top, baby. Think about that. That's how the questions are balanced. But remember, it's a computer adaptive test. So however you answer is going to determine what the next answer is going to be. Shout out to you, Colleen from Louisiana. Hey, Colleen, do you got like a Louisiana accent? I'm curious. In LPN program? Okay. All right. There we go. What, for real? Wait, Kimmy, what you mean? What you mean? Hey, real quick, commercial break. Hey, participate. That is the key. You better talk to me, because if you don't talk back to me, I'm going to be mad, okay? I'm just saying. Hey, share, follow, and give me all them likes. Give me all them likes. Make sure you share and you follow. That is the trifecta of TikTok, baby. Don't be selfish your whole life. Hey, don't come into my chat. You come into my chat acting a fool, I'm gonna ban you. You trying to sell me nudes when I can get them for free? I'm also gonna ban you because I got morals. All right, don't be rude and don't be weird. I got these questions off nurselabs.com. And they're right there, baby, right there. Also, I give people the finger if you start to act up. All right. 7-day NCLEX course, $48. It is going away, $48, and you get all the updates as I update this program. Baby, we about to put 150 videos, content videos up in here to include a new NGN review, as well as, breaking down the 8 sections of the NCLEX pie. I'm just saying, you can get it for $48 or not. You do you. If you need coaching for NCLEX, I do one-on-ones. You can check that out in my bio. Also, we're going to do a Ask Me Anything after this, all right? So appreciate everybody being here. And it's funny, every single time I do a commercial break, I lose 150 people. They're just like, bro, I ain't smelling what you selling. Shut up and give me questions. I'm like, all right, bro, I got you. Heather, what up, girl? I see you out there. Here we go. Question number 21. While explaining an illness to a 10-year-old, what should the nurse keep in mind about the cognitive development at this age? They are able to make simple associations of ideas. They are able to think logically in organizing facts. Interpretation of events originates from their own perspective. Conclusions are based on previous experiences. Heather, what's awesome? I don't know what I missed. Is there a date when the lifetime price expires? It expires on Black Friday. It expires on Langley. It expires on Black Friday. But once you get it forever. Like, I'm not going to turn it off. I'm not like, people that are in there are in there. That you do this for people. I love doing this. I have been an educator in January, it'll be 8 years. I was a surgical technology instructor for 3.5 years. I did everything in that program, from helping rewrite the curriculum to, simulations to clinicals to being on the podium. I did all that stuff. Hey, 10 seconds, y'all. 10 seconds. All right. I'm also a trauma nurse instructor, a tactical combat casualty care instructor in the military, pre-hospital trauma. I taught advanced burns. I taught ACLS. I taught a whole bunch of stuff. So this is what I love to do. I love to teach. Going back to school to get my master's. So you already know what we're doing out here. All right, y'all, here we go. Here's our answer. In 3, 2. And our answer is B. It says, I just stopped by to say, but I've already been through the NCLEX. Good luck to you. Shout out to you, Heather. Thank you. Congratulations. Thank you, Lena. Appreciate you. Hey, so the answer is B. They are able to think logically in organizing facts. The child in the concrete operational stage, according to Piaget, because it's French, like Target, is capable of mature thought when allowed to manipulate and organize objects. That's part of psychosocial integrity. All right. Any tips for studying farm? That's the worst for me. I have a couple of, you can go to my TikTok, and I actually have a couple of things where I talk about how to break down pharmacology stuff, the geeky girl, to essentially kind of make it a little bit easier. All right. So, hey, 6 to 12%. All right. Here we go. Question number 22. The nurse has just admitted a client with severe depression. From which focus should the nurse identify a priority nursing diagnosis? Is it nutrition, elimination, activity, or safety? All right. Hey, if you guys are just joining, we are doing NCLEX questions. I got them off nurselabs.com. Make sure you guys smash that like button. Make sure you guys share this live, and make sure you guys follow me, because I'm kind of cool, funny, but whatever. I don't care how you feel about me. All right. And I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, hey, that's cool. What do you do? And if you tell me that this question is easy, I'm just going to be like, duh, or maybe, or just depend on where you are at in your study life. Can you move the question a little down the box? Okay, let me see what I can do. Let me see what I can do. Is that better? I think, yeah, that looks a little bit better. All right, I'm gonna give y'all 10 seconds. To Corpus Christi, Texas. Not in nursing. Hey, I went to Texas A&M in Corpus. Very nice university. I'm not a fan of Corpus. Not at all. I'm just letting you know, not a fan of Corpus. I like Mustang Island and I like Port Aransas. All right, here we go, y'all. Here's our answer. Retaking med-surg too. That's all right, girl. Here we go. And the answer, of course, is D. Safety is priority of care for the depressed client. Precautions to prevent suicide must be a part of the plan. Depression can be effectively treated in primary care setting using an evidence-based collaborative approach in which primary care providers are systematically supported by mental health providers in caring for a caseload of patients. Psychosocial integrity, 6 to 12%. All right. Lower end on the NCLEX, but definitely a very important one. Definitely very, very important. Remember, when you guys are reading your questions and you're doing your rationales, and when you guys are studying, this solidifies what you are learning. All right. Don't be that person be like, oh my God, I just don't get it. Well, you better figure it out. You better figure it out for yourself. Figure out what type of learner that you are and how you retain information, and then go forward with that. All right. Wait, hold on. There's always someone that is just like, I'm not a nurse and I'm getting these right. Stop. Now, that reminds me of that SpongeBob meme. Just like, I'm not a nurse, so, but it's okay. If they're not a nurse and they're getting it right, it's okay. That's all right. They just some little smarty pantses. It's all good. Question 23. Which playroom activity should the nurse organize for a small group of 7-year-olds hospitalized children? Is it games or sports and games with rules, finger painting and water and water play, dress up, clothes and props, or is it chess and television programs? I literally was about to say cheese and television, and I wish somebody would have corrected me. Can't see the age? What you mean you can't see the age? All right, let me try to back this up a little bit. Alyssa, I just passed mine yesterday. Whoa. Who just said they passed NCLEX? Holly said, I just passed mine yesterday. Don't be intimidated. It's not scary as I thought. It's not scary because you passed. But Holly, let me tell you. Hey, everybody right now, while you're answering, y'all need to tag Holly and tell her congratulations. Hey, Holly, I'm super proud of you. I know that you worked really hard. I know that you studied really hard. Congratulations. Welcome to the shit show, the greatest shit show on earth. Being a nurse, either it be an RN or an LPN, congratulations to you. What type of nurse are you? All right, I'm going to go ahead and we're going to answer this question. All right, so there's the answer for y'all. It is a sports and games with rules. The purpose of play for the 7-year-old is cooperation. Rules are very important. Logical reasoning and social skills are developed through play. Okay, but Holly, congratulations. You are an RN, Holly. Is that what you said? Congratulations to you. Congratulations. Welcome. Hey, now that you worked really hard for that license, don't let no motherfucker play with you. And by that, don't let them try to put you in situations, which they will. Don't let them put you in situations where they will put your license at jeopardy, because they don't give a fuck about you and they will replace you. Listen to me when I tell you that. All right. You guard that fucking license with your life because you worked hard for it. All right. Safety and infection control, y'all. Don't get hung up on the sports. It says games, right? Okay. There you go. Hey, Chelsea, you graduate on the 9th. Okay, Kevin, that part. Jimmy, that's what I'm talking about. Holly, you're welcome. I'm just saying, hey, I've been thinking, if I was to start like a mentorship group, like a nursing group of some sort on new grad stuff, and would anybody be interested in that? I work in the OR. I worked in the ICU, PACU, and OR. All right, here we go. A client is discharged from hospitalization for congestive heart failure. The nurse teaching the family suggests that they encourage the client to rest frequently in which of the following positions? High Fowler is like, oh yeah, bring that. High Fowler, supine, left lateral, or lower Fowler. I think nurses are awesome. I could never do it. Hey, it's not for everybody. It's definitely not for everybody. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurselabs.com. Okay. Free questions off nurselabs.com. I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a doctor, if you're not a nurse or anything, let us know where you're from. Also, smash that like button, share, and follow, and get this out to people who may need it, okay? Hey, I don't know what A and D are, but maybe A. Okay, I'd rather you guess. A and D, low Fowler and high Fowler? See, not everybody knows. Not everybody knows what the lingo is for people that are like, this is easy, because they're not there yet, or they're not even a nurse. So everybody, hey, equal opportunity answers out here. All right, I'll give y'all 10 seconds. But I've been thinking about starting like a like a mastermind type of like nursing group. Maybe down the line in the future, where I can get some more people that are, kind of relatively like my attitude, mentoring nurses. I'm telling you, mentoring, what a dumb question, perfect for a nursing exam. Exactly. Exactly. There we go. And the answer is high Fowler. Sitting in a chair or resting in a bed in a high Fowler's position decreases the cardiac workload and facilitates breathing. All right. Health, promotions, and maintenance. It's a lot of work, but worth it. Facts. LPN for 3 years. Shout out to you, Shannon. Angela from NYC. Shout out to you, Ange. High Fowler's is 90 degrees. Low Fowler's is 30 to 44. Well, yeah, 45. I got you. I'm picking up what you're putting down. I want to apply for nursing school, but I'm scared. If you're scared, go to church. And if you're going to let the fact of somebody to close a door in front of you while you can't go around and find other doors, then maybe you don't need to be a nurse. And Dom, that's probably real aggressive the way that I said that, but I'm being completely honest with you. If you're scared, go to church. Don't be afraid of nothing. You better apply, and you better apply. If you really want to be a nurse, you ain't going to be scared of nothing. You better make it happen. Appreciate everybody for the follows, all right? Hey, but here we go. On to the next one. Question 25. TT, shout out to you for being in your first semester of your accelerated BSN program. There you go. Hey, here we go. Question 25. The nurse is caring for a 10-year-old on admission to the burn unit. Shout out to anybody that's worked in the burn unit. That was the first ICU that I worked in, and I loved it. One assessment parameter that will indicate that the child has adequate fluid replacement is urinary output. 30 per hour. No complaints of thirst, increased hematocrit, or good skin turgor around the burn. What are we thinking? Shout out to all 300 plus of y'all. Geeky, you're in your second semester? All right, girl, I see you. I see you out there. Hey, but shout out to all 300 plus of y'all that are in here. All right. We are going over NCLEX questions. I got them off nurseslabs.com. Make sure you guys like, make sure you guys share, and make sure you guys follow. Don't be greedy your whole life. I need at least like 50,000 likes. Is that too much to ask? 50,000 likes? I don't even know anymore. But make sure you guys share, because you guys never know who this is going to help. This has helped so many people just being here and being in a good group in a community full of folks, going down the same journey. All right. 10 seconds, y'all. 10 seconds. Turgor is good, but pulling it on a burn. See, now think about it. If I had a burn, right? What do you think the skin will look like around a burn? All right. That's why you always hear me say, paint the picture. All right. I finished my nursing degree as of yesterday. Shout out to you. Hey, now you just got a few more steps to cross that finish line. Study for that exam. Here we go, y'all. Here's our answer in 3, 2. And the answer is A, urine output more than 30 per hour, right? For a child of this age, this is an adequate urinary output, yet does not suggest overload. Disruption of the sodium, the AT pace activity presumably causes an intracellular sodium shift, which contributes to hypovolemia and cellular edema. Heat injuries also initiate the release of inflammatory or vasoactive mediators. These mediators are responsible for local vasoconstriction, systemic vasodilation, and increased transcapillary permeability. Increase in transcapillary permeability results in a rapid transfer of water, inorganic solutes, and plasma proteins between the intravascular and interstitial spaces, right? That's why you see all that swelling starts happening, right? PICU nurse here. INOs are so important. INOs tell you so much about those kidney functions as well. I'm telling you, think about it as this first of all, that's part of physiological adaptation, third largest section on the NCLEX at 14 to 17%, all right? But think about it. When one organ goes out on the body, I'm trying to tell you, it's like where one of those microchips goes out in your car and your whole car shut down. All right. Just letting y'all know that. Think about it like that. Put it into ways and context that is easily for you to understand. Everything can be transferable. But real quick, we're doing NCLEX questions, commercial break. Participate. I love y'all down here in the chat. Y'all keep it up. All right. Give me all them shares. Make sure you share. Make sure you follow and give me all them likes. Don't be selfish your whole life. This is super helpful for you have no idea. Right. If you come to my chat and you try to be funny and try to troll, I'm going to ban you, all right? If you try to fucking sell me your nudes, I'm going to ban you. Why sell me stuff when I can get it for free? I'm just saying, OnlyFans codes, They're free out here. I'm just letting y'all know. Let me stop. Anyways, hey, I don't gatekeep. Nurseslabs.com. This is where I got these questions from. All right. So make sure you guys go over there and check that out for yourself. 7-day NCLEX course, $48. It is going away on Black Friday. I'm telling you right now, if you try to go to the website, it's not going to be there. All right. Link is in that bio. If you need one-on-one tutoring for NCLEX, go over there and you guys can look at that page. And if one-on-one coaching is what you need, baby, I got you. Also, we're going to do an AMA after this. So you guys can ask me questions pertaining to nursing or do whatever, and you can ask me personal questions too. But if you're weird, I just won't answer you. So there's that. Here we go. Question 26. What is the priority nursing diagnosis for a patient experiencing a migraine headache? Is it acute pain related to biologic and chemical factors? Anxiety related to change in or threat to health status? Is it hopelessness related to deteriorating physiological conditions? Or is it risk for side effects related to medical therapy? What are we thinking? Shout out to all 300 of y'all that are in here rocking with me. Make sure you guys like, make sure you guys share, make sure you guys follow. That is the TikTok trifecta. All right. I want to know who you are, where you're from, and where you're at in your nursing journey. And I got these off of nurseslabs.com. Nurseslabs.com. Main word says acute. There you go, Chelsea. That's how you break questions down. This is how you break questions and your answers down. Heather, thank you for the follow. Appreciate you. Heather Strickland. Like Strickland propane, like propane and propane accessories. All right, here we go. 10 seconds. You have to graduate from school in order to take the NCLEX. Are you asking me, Erica, or are you telling me? I don't know. Or that was another question. She's like, haha, I get that all the time. Hey, I'm just saying, I bet sometimes, one girl, her name was in here, Felicia, and I was like, bye. And she was just like, wow, really? Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is A, acute pain related to biologic and chemical factors. The priority for interdisciplinary care for a patient experiencing a migraine headache is pain management. That is part of physiological adaptation, third largest section on the NCLEX. Make sure when you guys are studying, this is the way you retain the information that you have learned. I'm trying to tell you, you read the content, apply the content to the questions, and then you reinforce the questions and the content by reading and reviewing your rationales. All right. I'm just letting y'all know. Here we go. On to the next one. The website is nurseslabs.com. Who asked me that? Jalissa. You know anyone who does one-on-one tutoring for specialized HESI? Is it Briance? Is that how you say it? Briance? Ma'am, I do. Wait, I think I do know one. Her name is the nurse Sam. I think she does HESI and ATI. I don't know about one-on-one though, but you can check her out on Instagram and stuff like that. Retired nurse having fun remembering this. There you go, Missy. That's what I'm talking about. Here we go. Question 27. You are creating a teaching plan for a patient with newly diagnosed migraine headaches. Which key items should be included in the teaching plan? Select all that apply. Hey, just let y'all know. Select all that apply questions are now partial credit on the NCLEX. I'm telling you, that's a godsend. Y'all are lucky. Is an RN for only 2 years? I don't know what that means. What do you mean? I've been an RN for 3.5, actually. What is it? Avoid foods with tyramine, such as alcohol and cheese. Avoid foods with, is it Tagamet, nitroglycerin, and nifedipine. Abortive therapy is aimed at eliminating the pain during the aura. The potential side effect of medication is rebound headache. Complementary therapy, such as relaxation, may be helpful. Continue taking estrogen as prescribed by your physician. What are we thinking? ADE. Okay. Got C and E, ADE. I'm going to give y'all 30 seconds. This is kind of a long one. All right. I'm a high school senior and I'm trying to decide. All right, high school senior. Hey, you up in here with the big folks. No, I'm just messing with you. But hey, go ahead. Give us your best educated answer. To the NCLEX in August, the partial credit is amazing. Hey, I'm telling you, as somebody who took the NCLEX 3 times and I passed it on the 4th, I'm letting y'all know right now. And somebody who teaches or coaches people for their NCLEX, I'm telling you, the partial credit is awesome. It is awesome. All right. 10 seconds, y'all. 10 seconds. Hey, if you're new here, I got these questions off nurselabs.com. Make sure you guys like, share, and follow. Who said hey to me? Nurse Erin. Hey, what's up, girl? ASMR. I see you out there. All right, here we go, y'all. Here we go. Here's our answer. In 3, 2. Can you get your RN with a bridge program if you're RN LPN with 1 year experience? If you go into a bridge program from LPN to RN, yeah, you can, for sure. I mean, they have them. They're LPN to RN bridge programs. So here we go. And the answer is A, B, C, D. And E. The client should be counseled on the food and drugs that are allowed. He should also be educated on the side effects of the medications given. Methods of distraction for pain should also be included in the teaching. That is part of health promotions and maintenance. 9 to, I believe, 12% of the NCLEX. All right, one of the still smaller section, but doesn't just because it's small doesn't mean it's important. All right, yeah, baby, that's what I'm talking about. Shout out to you, Leanne. I see you out there. Is that a finger as somebody's freaking profile? That's funny. All right, here we go. Question number 28. Shout out to all y'all in here rocking with me, smashing that like button. Make sure you smash it, like, and follow. Here we go. Question number 28. The patient with migraine headaches has a seizure. After the seizure, which action can you delegate to the nursing assistant or the CNA or the UAP? You will mostly see UAP on the NCLEX. Document the seizure, perform neurological checks, take the patient's vital signs, or restrain the patient for protection. All right. Everybody screaming C at me. All right, cool. Shout out to all 340 plus of y'all up in here. We're in here rocking. I want to know who y'all are, where you're from, where you're at in your nursing journey. I had some people in here from Nepal. To me, that is wild. I'm just like where Mount Everest is at. They're just like, yeah. I was like, yo, I need a tour. I ain't never climbing Mount Everest because they got dead bodies up there. I'm just saying. I mean, not dead bodies, just bodies that are no longer walking the earth. There, I said it that way. Oregon, shout out to you, Christina. Florida, okay, I lived in Florida for about 4 years. Shout out to Duval. Oh, you're in Nepal? That's what I'm talking about. I don't know what it is about Nepal. Like, I'm infatuated with that country. I don't know why. Arkansas, shout out to you, Chelsea. Oh my God, like I'm talking, like we friends. Upstate New York, you mean you're in Canada? Detroit, okay. Liv is in Canada. Okay, here we go. There's our answer, y'all. And the answer is C. Wisconsin. Who is that? Is that Jackie? Jackie, do you got a Wisconsin accent? Like you say, hey, can I have a bag? Puerto Rico, shout out to you. Jersey. All right, here we go. Hey, taking vital signs is within the education and scope of practice of a nursing assistant, part of management of care from so you from Louisiana, Montana. Oh, Jackie got that bag accent. From Malaysia, shout out to you, Ice Latte. I've always wanted to, hey, look, hey, the passport is about to get stamped, baby. I'm just letting y'all know. All right, y'all, shout out to y'all. Shout out to y'all for getting this right. Let's go to the next one. Shout out to Missouri, Mizzou. I'm about to butcher this. Is it Calgary? Where's Calgary at? Where is that at? Here we go. Here's question number 29. You are preparing to admit a patient with a seizure disorder. The Philippines. Which of the following actions can you delegate to the LPN or LVN? All right. Is it complete admission assessment, set up oxygen and suction equipment, place a padded tongue blade on the side of the bed or bedside, or pad the side rails before the patient arrives? Alberta, Canada. That's what I thought. See, my geography ain't all that great sometimes. Hey, but shout out to all 300 plus y'all in here rocking with me. We're doing NCLEX questions. Got them off nurselabs.com. I need for everyone to smash that like button. I need for you to share it to as many people as you can. And I need for you to follow, because that is the TikTok trifecta that they like to see. All right. I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse or on that journey as a nurse, what do you do, or what are you doing? Hey, by the way, my LPNs, LVNs, my patient care techs, my occupational therapists, physical therapists, all of y'all, I love all y'all. And like my med lab folks, all y'all. I love every single one of y'all, because I'm telling you right now, as a nurse, I don't give a fuck what nobody tell y'all. Like, y'all are needed, y'all are loved, and y'all are wanted, because without y'all, we can't do this shit as a fucking team. I'm a phlebotomist. Shout out to you. Is it Sierra? Your program is good, but you talk too much. Sorry. Hi, I'm in the Philippines. 10 seconds, y'all. Is this a SATA? No, it's not a select all that apply. First semester student, shout out to you. Any tips for health assessment class? You honestly, it's repetition for health assessment. Here we go. Here's our answer. In 3, 2. And the answer is B. Set up oxygen and suction equipment. That is within the scope of practice for the LVN to set that up. It is part of management of care, right? So, I don't know. This is definitely a tricky one, right? It's definitely a tricky one, for sure. I am from Texas. Me too. The website is nurseslabs.com. Nurseslabs.com. But shout out to all y'all for being up in here. Appreciate everybody. Get this answer. Remember, you guys retain these answers. Retain the answers, right? It's a trifecta. Content, questions, rationales, right? Especially seizure precautions. There you go. All right, here we go. Question number 30. Question 30. All right. A nursing student is teaching a patient and family about epilepsy prior to the patient's discharge. For which statement should you intervene? Meaning, what did the nursing student say that was incorrect? Been an RN in Kentucky for 34 years. Cricket, I just turned 36. How you feel about that? Nah, I'm just playing, Cricket girl. You know I love you. Shout out to you. I appreciate you being here. Is it you should avoid consumption of all forms of alcohol, wear your medical alert bracelet at all times, protect your loved one's airway during a seizure, or it's okay to take over-the-counter medication. Blah. I'm sorry, Cricket. My bad. Oh, I like this. I'm so what? I am underboard nursing graduate. Okay. Got D's. Okay, everybody screaming D at me. Barbie, thank you for the follow. Appreciate you. I'm going to give y'all 15 seconds. No, I'm going to give y'all 10 seconds. Miss Strickland Propane over there, what'd you give me? Did you give me C? You gave me D. Got you. Appreciate you. DJ, thank you for the follow. Is it Brissa Martinez? Thank you for the follow. Rose Cricket, thank you for the follow. I appreciate you. Hey, if you come in here and I start picking with you because you got one of those names or you tell me something, hey, just know it's all out of love, okay? If I don't pick, hey, I'm just saying, I don't pick on you. Don't mean I don't like you. You know what I'm saying? Here we go. And the answer, of course, is D. It's okay to take over-the-counter medications. A patient with a seizure disorder should not take over-the-counter medications without consulting with the physician first, right? Why is that? Answer down in the chat right now. Yeah, Kiki, you got it right. So what? There you go. The suction for the airway. There you go. Airway protection. Good job. Appreciate you, Kendall, with that answer. Is it Kaya? Or Kaya? I'm butchering that. I'm sorry. Thank you for the follow. Or I'm sorry. Yeah, thank you for the follow. Appreciate you. Hey, health promotions and maintenance, y'all. Remember, questions or content questions and reading and reviewing your rationales, right? There's no fucking tricks. There's no tricks at all. People are just like, hey, I'm going to teach you the tricks, so I'm going to do this and the third. Also, we're in the first span or the second span of NCLEX season. Don't get scammed out here. Don't get scammed out here, all right? Because people are just like, hey, I can get you your nursing license and the answers for $1,500. Yo, I'm telling you right now, don't do that. Because then you're going to be mad when the shit don't work. And then you're going to be mad that you're going to be out $1,500. So put in the fucking work. Put in the work. All right, but hey, that's a wrap, y'all. That is a wrap. I appreciate y'all. I appreciate y'all for being here. We do these questions every Monday, Wednesday, and Friday. Monday, Wednesday, and Friday at 5:30. I appreciate you guys hanging out and participating. I really do love each and every one of y'all because y'all are on the journey to really not only taking care of patients, but in reality, taking care of yourself. Because I'm telling you, if you can't take care of yourself, you are fucking no good to no one. Not them kids, not that spouse. Fuck them all until you get what you need to do for yourself. All right. You said you took your NCLEX on paper. Ma'am, that was like in 94. Once upon a time in 94. All right, I'm done. I'm sorry. Hey, I did have to ban a few people. I'm not sorry. I'm petty over 9,000, Vegeta style. Okay. Nurseslabs.com is where I got these questions. 7-day NCLEX course, $48. I said it is going away on Black Friday. I'm telling you right now, it's going away. So if you want it, hey, I would recommend going and getting it. And you're going to get all the updates. So if you graduate here in the next 6 months, 3 to 6 months or whatever, or a year, hey, you get it forever. Who's to say you can't get an NCLEX review for $48? So go over there and check it out. All right. If you need one-on-one coaching, you guys can check that out as well. You guys can check that out as well. That link is in my bio. And that's pretty much it. Chelsea said I graduate in December. I graduate 6 months from today. Well, Sassy Spoon, it'd be great for you. All right. So, hey, I'm going to turn this thing around so you guys can see my disgustingly hideous face. Man, that is bright. What is up? Hold on. I got to turn that down. Oh. Hey, what's up, y'all? What's up? Welcome. My name is Kevin. You know what I'm saying? People are just like, what do you look like? Well, obviously I look like this. You know what I'm saying? Obviously. Cricket, good night. So, hey, welcome. You guys can put a face with all the, I should just be like an auctioneer of some sort. You know what I mean? But I'm so used to doing this and I'm so used to teaching that I have to do these fast because people are like, you talk too much, or can you just get on with the answer? Didn't know I was on your time. Sorry. Maisha, you love my life. Ma'am, I love you being here. What is the passing rate for your program? So as of right now, I'm working on my analytics right now, but I have almost 200 people inside of my program. And like I said, it's in this pre-launch phase right now, but I have had 10 people right now tell me. But remember, people are in different stages in their, right now. Some people got it like right when they started nursing school and don't graduate for a year. So it takes time. It's a brand new program. So, but right now, I've had multiple people tell me that they passed. And with my coaching as well, I have those testimonies on my page on the website as well that I've with the coaching as well. So, and with my coaching, I've been coaching since 2020, and I've coached over 100 people, and probably like 5 of them didn't pass, and that had nothing to do with me. Nothing to do with me. So you keep it entertaining. You don't talk too much. I appreciate that. For T's test. So for the T's, I would tell you there's a Mometrics book. Wait, are you talking about the entrance, or are you talking about like, the other stuff? Is it Monomami? Bye. If doctors are the only ones that can diagnose, okay, Big Mike, there you go with the question. If doctors are the only one that can diagnose, why do nurses need to know this? Honestly, in reality, it is a checks and balances. What degree do you have? I have a bachelor's degree in nursing. It really is a checks and balances, because no one's saying just because you don't diagnose them doesn't mean you don't need to know what the diagnosis is, because you are an intricate part of the team. And if they diagnose them with something, that's fine. But then when it comes to the orders that they give, you need to be able to be like, that's not right. That's too low, or, ooh, that's not enough. Or like I've had doctors be like, yeah, let's give them 50,000 units of heparin. You want to what? So you got to be able to know these things, and you got to be able to verify and clap back, because just because they give you an order as a nurse does not mean it's right. Because best believe, if you follow a doctor's order and based off of your training and you know it's wrong, that's that ass. Just like I'm telling you right now, nurses save doctors. And by save doctors, I mean they save doctors their licenses and a lot of fucking embarrassment. It says residents aren't always all knowledgeable. You are very correct. You're very right. Misha said, we need to know the diagnosis so we can know the process of the disease. Exactly. That's what pathophysiology is for, right? It's a great class. One of my favorite classes. But anyways, so like I said, I've been a nurse for 3.5 years. I worked in 3 ICUs. So the burn unit, the medical, and the neuro ICU. I learned a lot there. I left right after COVID. The second wave of COVID started to die down. I worked in the PACU, and I've worked in the operating room. I'm in the Navy, been in the Navy for 16 years in September. So I'm on the road to retirement. Like I said, I've been an educator. I'm a master instructor in the Navy as well. I've been a master instructor for 8 years. So this is my jam. I enjoy doing this. I enjoy doing this a lot. Cindy, they human too. Yeah, appreciate the follows. Any tips for someone pre-nursing? I would definitely, is it Jillian? I would say definitely start doing your researches on your schools if you haven't, right? And make sure that they're accredited and check out their NCLEX pass rates. Also start to develop your time management, because when you get to school, it's going to humble that ass. Trust and believe me when I tell you that. Okay. I'm about to use my GI Bill. Jillian, I did nursing school while I was on active duty, and I used my GI Bill. Lena says, thank you for your service. I appreciate your support. Lena, thank you. Miss Mystique or Miss Neek says, hi. Hey, how are you? What do you do now? So I work in the OR, but right now I am on temporary family leave because I got hurt at work. So I had to have surgery on my knee back in September. So now I'm at home and I'm doing this. So this is what I'm doing. This is what I do essentially full time, is my course, creating that and doing my coaching. And I do these TikTok live. So I enjoy doing these. But I failed the NCLEX 3 times, y'all. First time I took it was in 2018, right after graduation. And I got 75 questions, and it was terrible. I did terrible. May says, hi from the Philippines. Hi, how are you? How about, what is I don't know what is REAS. What is REAS? I don't know what that means. Sorry, your knee's bad. My knee is actually getting a little better now. I have physical therapy coming next week. So, on the road to recovery. Heather says, where did you work right after graduating? How do you know that's where you wanted to go? So my goals and ambitions, that I wanted to be a CRNA, and I know I needed to go to an ICU. With me being an instructor, I had some connections at a hospital, and they were just like, yeah, you can come and, work here at the burn ICU. And I did, and it was great. And I loved it. So, Marie says she takes her NCLEX in January. What you crying for? Gigi says, I'm in the Air Force Reserves as a flight medic with my EMT license, trying to get my benefits together. Ma'am, you got to do it. Shout out to the flight medics. Shout out to those fixed wings, flying in them C-17s and C-130s. I know a little bit about those. So, what is this? Godspeed recovery. Oh yeah, we good out here. Take it one day at a time. Is CRNA school still your goal? No, my goal is no longer CRNA. When I left the ICU, I left that dream of being of being a CRNA, and I realized where my goal was, and it was teaching. This is my dream. Do you still have a dream? No, my dream is to teach, and that is my goal. My goal is to teach, and most definitely, it's mentor. It's mentor. You're scared. If you're scared, go to church. What floor or unit was your favorite and why? I loved the burn ICU. I loved it. It was a 1-to-1 ratio, but you got to learn everything that you needed to know, from time management, drip management, hemodynamics, wound care, like airway management with the vent. Like, you got it all. And I loved it. But since that was like my first spot, like I was still active duty, but I was getting all this training in there. They were just like, hey, we want you to go out and go get some training somewhere else, and then we want you to come back. And I was like, all right, cool. And then I went out and I went to a civilian hospital. I was at a military hospital too. That's kind of where the connects happened. So loved it. And then I went to a civilian hospital, and I was just like, oh, hell to the no. But then I realized that I missed teaching. Like, I taught for like 7 years straight. And then I loved it. And then I was away from it, and I couldn't do it so as much as I wanted to. So then that's why I was just like, I'm going to go back and I'm going to be an educator. And that's what I want. I love to teach. I didn't think about it. Sometimes I'll go talk in the mirror. I'll talk in the mirror. I'll go through my everything, and I'll be like, okay, I feel that. You have to learn how to inflict communication, stuff like that. Love it. So my words to y'all is that if you have a dream and that's what you want to do, go do it. But if you change your mind, that's okay. Don't let motherfuckers out here say, like, oh, you should have did that. Hey, you should stay out of my fucking mouth. How about that? I'm sorry. But y'all know what I mean. I just started UT Health Science in H-Town program. I'm so scared. Don't be scared. Because it's going to come whether or not. It's going to happen whether or not for you, okay? But time management. And I'm telling you, your first semester is going to humble you. Were you at a teaching hospital? No, I was not at a teaching hospital. Hindsight's 2020. Anybody that's going to, any nurse, anybody that's about to graduate and go to and start their first nursing job, if I'm telling you right now, is there any suggestion that you ever take from me? Go to a level 1 trauma facility. Go to a teaching hospital. Go to it. More power to you for wanting to teach. I love teaching. I love it. It's a blessing to find your dream. Facts. I'm critical care float nurse, and burn ICU is one of my favorite units to work. I love the burn ICU. I loved it. Are you a PhD or a mentor? So right now, I just have my bachelor's, and I'm working towards my master's. But your degree doesn't determine your amount of mentorship. Because I have, a military background, so I mentor all the time. But I have thought about going for my PhD, but then, you can get your education, or you can get your doctorate in education too. So that's another route that I'm going for myself. So, the options are always there. But hey, I appreciate all the likes. I appreciate the follows. Make sure you guys keep doing that. Keep liking, keep sharing, keep following. If you guys just joined, you guys missed a whole hour and some change of where we went through NCLEX questions. So we do them every Monday, Wednesday, and Friday. I always want to know who people are, where you're at in your nursing journey. That's the stuff that I like. And I want, hey, what questions do you guys got? What y'all got? Hold on, let me see what y'all got. It says, we need more nurse educators who are passionate like you. You want to know something, Demire, or is it Demir? You want to know something? You want to know what destroys nurse educators? It's fucking hospitals. It's the hospitals. It's the politics in the hospital, and it's the administrators. That's what does it. And your willingness to mentor. I love to mentor. I love to do it. Like, if I could grab everybody like under my arm and I was like, hey, let me show you what I've done so you don't make the same mistake, I would do it. And I don't know everything. I got mentors that do the same thing to me. Mentors that are have been nurses for 15, 20 years, so I got them too. Nurses. What I'm guessing you're asking, why are nurses leaving bedside? Hold on. Our courses for the master significantly hardened. Lindsay, honestly, they're not. Like, they're nowhere near as strict and strenuous when you're in your master's program. It's just, honestly, it's just like when you're doing your prereqs. That's kind of what when you get your master's is like. Where can I find your course? You can find my course on the link in the bio, and it'll take you. It'll say 7-day NCLEX course. Are you currently in school for your master's? Lena, yes, I am. What time do you start? So I can be on from the beginning. Is it Misha? 5:30. 5:30 Central Standard Time, so Monday, Wednesday, and Friday. If you follow me and you go to the link, if you go to my bio, it'll say, TikTok live Monday, Wednesday, Friday at 17:30. Yep, so true. Just got started at 43. Really? You're really helping focus on areas to improve. Facts, right? We don't need educators. We need floor nurses. Well, Deb, let me tell you something. Let me tell you something. In regards to that statement that you just tell us what we need, I can tell you right now that you can need floor nurses all you want. But if those fucking nurses are not educated and if they're not treated well in all aspects of nursing, you ain't getting none of that, period. And that's exactly why nurses are leaving, because of how people treat them, how they treat us, right? How you don't get, how you're not taken care of. There's no safety protocols. You know, like they have safety protocols, but they don't give a fuck about the bottom line. They don't give a fuck about you. You see what I'm saying? We need black educators. I agree. We need black educators. We need educators all around. Papers, facts. I'm just letting you know, what university are you attending? Is it online? They have a Western Governors University. Facts. And that's what I'm saying. Like, you can come here and say, like, we need floor nurses. What you? So I'm trying not to be that dude, because trust me, best believe I can be that dude, right? This is why, like, when I used to work the floor, people didn't really bother me because they come at me with stupid shit, right? And so I'm just like, we need more floor nurses. Okay, if you need more floor nurses, tell your fucking administrators. Tell your administrators and all these big hospitals like HCA that made like $9 billion last year, or the CEO of HCA that made $30 million last year, to put more money towards these people. How about that? How about that? Just a thought. Just a thought. Hey, but hey, look, I'm just a random motherfucker on TikTok who went through the second wave of COVID, who went through a bunch of shit that a whole bunch of other people went through. Those people that went through the first wave of COVID, those are the things that are happening. And those are the things that people fucking fail to realize, is that you try to say, hey, we need more of this. Okay, we'll provide better, and maybe they'll stay. I don't know. God bless you. A lot of people have pride and are arrogant and selfish, and they don't like teaching. And that's another thing that really upsets me too, is some people are just like, oh, I don't want to teach students. How dare you say that you don't want to teach a student? How dare you? Because you obviously just fucking know it all. You came out of nursing school and be like, hey, bro, I don't need you. Oh, okay. So you just fucking selfish like that? I hate people that are like that. I hate them. Thank you. I enjoy your vibe. They're helpful and keep me engaged. Such a good vibe. Hey, I appreciate you. Is it? Is it Nikayla? Nikayla. I was like, how the hell do I say your name? Nikayla, I appreciate your nice words. I used to be an educator while working the floor. So you used to be an educator working the floor. And so now you're saying you need more floor nurses. Once again, the problem is not with you, right? And this is, I don't want you to think this is for Deb. I don't want you to think I'm directing this towards you. And I understand I used to be the educator on the floor. But you and I both know, especially if you've been an educator on the floor and you worked as a floor nurse, that these motherfuckers up here won't change nothing to make it better at the level of which we work when it's on the floor. So are you surprised when you have nurses and you have hospitals that have turnover rates from 6 months to a year and a half? These motherfuckers get their education and they dip. I ain't mad at them. Bye. Go do you. Because best believe these motherfuckers gone are the days where these hospitals are just like, yeah, work here and we'll do everything for you. Gone are those days. There's so many companies and so many other people out here, from nursepreneurship to non-traditional nursing jobs to insurance companies, where nurses can literally sit in their fucking house and not be bothered by nobody and make $30,000 to $50,000 more than they were making. So why the hell would I want to go work at somebody's floor or stay there? Lena, look, I'm trying to people need to stop playing with me. And Deb, like I said, this isn't directed towards you in a negative way, but it's just like, this is the shit that we have to talk about. Like, if we want change, we got to do stuff better. And by we need to really keep advocating for ourselves to be up there. Like, I'm a very unbiased person. when it comes to being a nurse, because I believe that, hey, go to where the opportunity presents itself for yourself, right? But if there's no change, it won't happen. It won't happen. And the biggest change, I bet you right now, if every nurse that was supposed to go in for night shifts just didn't show up, I bet you the hospital would be like, oh, well, guess what? They're going to go on strike, and then you're going to have strike nurses that are going there. And I'm very unbiased with that. Hey, go get your money. But then you got to realize that, hey, this is what's going to happen too. But then hospitals can't sustain paying strike nurses fucking, $180 an hour. You know what I'm saying? So some shit has to fucking change. You are so right. So many nurses right now need to teach, right? Amen. Amen. Hospital charge so much. Yeah, they do. It's the same shit in pharmacy. Workload is insane, and we need more people, but no one wants to stay. Jackie, can you blame them? We can't have more floor nurses without great educators. You're right. So it literally is like a double-edged sword. You can't have good floor nurses. You can't have good floor nurses without educators. And if you don't have educators, you're going to have terrible floor nurses. Right? If you pay them, they will stay. Yes, you will. Yes, they will. You damn right. Money, people don't believe, but money talks. Why do you think people leave to go be travel nurses? For me, or from somebody who made $25 an hour at one point, and then I go be a travel nurse, and I'm making, what I made in a month, I can make in a week. Make it make sense. Is it possibly Marina or Marina? Ma'am, you with the face and the long hair. I appreciate you. Thank you for the follow. Hey, if you guys are just joining, we're doing an Ask Me Anything for nursing, actually. We're just, nursing stuff, kind of just kicking the shit. We went through NCLEX questions. I got those off nurselabs.com. But if you guys are still rocking with me, I want to know who you are, where you're from, where you're at in your nursing journey. What do you got? What kind of questions do you guys have? Lena says, it's been great attending your live this evening. Thank you for all you do. Good night. Lena, you have a great night as well. I appreciate you being here. David said, a lot of my floor left as soon as I started as a new grad. They all left to go travel. David, I got a story to tell you. There was literally like 15 nurses that had like anywhere from 5 to 15 years experience. And then they all left. Same thing that happened. And 95% of my floor when I got there were all new grads with like less than anywhere from 3 to 4 months of experience. I swear to God. I swear to you. It was terrible. And then they wonder why people didn't stay. Getting ready for my NCLEX in Clayton, North Carolina. Shout out to you, Faith. Shout out to you. You got this. Keep preparing the same way you're preparing. I don't know how that is. Hopefully it's a great way, and go out there and kill that test. Is the pay different for an RN and a BSN? So let me is it Diana or Deanna? Let me clarify. So your RN is your license, your BSN is your degree. Okay. So by RN, I'm assuming you mean your ADN degree with your RN license. The programs are different because the BSN goes more into depth. Especially with research, right? A lot of things are included, like with research and then therapeutic communication and some other stuff, depending on how the program is. Is it a good thing for you to increase your degree like that? It's never a bad thing. Never a bad thing. But I can tell you right now, AD and RN will make the same as a BSN, or $1 more. Trust me. I've seen some ADNs that have been nurses for 10 years and they make the same amount as a BSN. Don't matter. I love your life. Jill, I appreciate you. I'm from Texas and now struggling with the Exit Hesse. So the Exit Hesse, I would recommend using that Elsevier or that Saunders book, and then start looking at things on YouTube for the Hesse. I am an LVN working on my bachelor's in Northern California. Oh, so you're in Oregon? No, I'm just playing. But shout out to you. It says, how can that happen? No one above to help out. What do you mean, TJ? It's like, yep. Best way to prep for NCLEX? I don't know. Well, here, somebody says, what do you recommend for NCLEX studying? Faith, give me a little bit more context. What do you mean? Give me some more in depth. Go more in depth in that question. So my opinion, best way for you to study for NCLEX. Number one, recreate the testing center. So, hey, no phone, no drinks, no nothing, computer. I always recommend doing your practice questions on the computer because your test is on the computer. So practice like you play. Put yourself on a study plan. Create a time management planner for yourself so you can trim the fat. Also, I would recommend doing, you need to be doing at least 85 to 150 questions a day or every other day. You need to be learning content. You need to be reading and reviewing your rationales, so on and so forth. That's what I would do. I'm in New York and I make 3 more. I'll make 3 more once I have my bachelor's degree. Ain't that funny though, Lindsay? Hello from Detroit. Shout out to you, Sharon. How are you? I'm from Florida. How can I find the T's? Shout out to Florida. Shout out to Duval. That's where I lived at for a little bit. Victoria, what's up, girl? I ain't seen you in a while. How's everything going with you? I'm from Florida. How can I find T's? I don't know what that means. What do you mean find T's? I took UWorld and watched Mark Klimick and passed the new gen with no problem. So for David, that probably worked for you. I used that same combination my first time, my second time, and my third time, and it didn't work. So I had to change it up. So I ended up using Kaplan and Mark Klimick, and that worked for me. It just depends on the combination, right? Graduate ADN on the 9th from West Virginia. Hopefully they take the NCLEX in December. Okay. Shout out to you, Jenny. Books for pre-entrance exam for HESI. Was it OW Beautiful? I would recommend the Mometrics book. It's a yellow book that you can find on Amazon, and it's like $33. Your hospital, you have, you said everyone left to travel. Yeah, so everybody left during the second wave of COVID. Good luck on trying to get anybody there. I'm ready to go. Oh, Happy Mom, what's up? I'm ready to go into the program. If I'm crying through prereqs, I can only imagine what's going. Hey, I'm telling you, you're going to get humbled real quick during your first semester of nursing school. I'm telling you, life's good, been busy. Grandma just went home on hospice. Okay. Shout out. Hey, go spend as much time with grandma as you can, and study for the T's when I can. Okay. Hey, sometimes we got to prioritize some stuff. So go spend time with grandma. Thank you for all that you do. Have a great night. Jackie, I appreciate you being here. Thank you. You have a good night as well. Have a good weekend. Please keep talking nursing care content all the time. That ain't going nowhere. That is my realm. That is what I like to do. Hope you're feeling good and healing well. I'm doing really well. I appreciate you asking. I actually have physical therapy coming up. So, is nursing school hard? Yes, it is hard. For some people, they'll tell you, nursing school is easy. Nursing school is hard. And if you've never been through it, you don't know how to prepare for it. That's just kind of how it goes. But, biggest thing is time management. It's like that everywhere. Other hospitals are having the same problem with staff. All hospitals, every single hospital is having a problem with staff. How long should I review? IWFH doing, I don't know what that means. WFH, I don't know what that means. Utilization review. My last bedside experience was 10 years ago. Oh, how long should you review? Ella, it all just, I don't, for most people, and if you haven't done anything for 10 years, I say that you need to get a review that, is an extensive one that's going to give you content, that's going to give you questions. Luckily for you, I got one, $48. You can check that link out in my bio, but it all just depends. Some people need 30 days, some people need 60, some people need 90. I recommend never studying longer than 90 days because if you don't know it by then, you don't know it at all. You doing PT yet? No, Victoria, I just told you that. Victoria, I'm doing PT starting next week. I can't wait to come back and tell Kevin, let me tell you what happened today. Look, and I'm going to be like, look, I told you. Can you give me advice on hard and impossible nursing instructors? So the thing about nursing instructors or all instructors is that, their the whole purpose of them is to teach you, but they're to weed people out, people that essentially don't need to be there. So the thing about it is just people are going to be a certain way to you, but they're at no point in time should they ever be rude and demeaning to you. So I would definitely take a log of any point in time they were being rude or anything like that. And then I would literally take it from tell them, start with them. And then if it doesn't, take it up. You can even get as far as they've done race discrimination and you could get a lawyer. No, you're good, Victoria. You're good. Race discrimination, you can get a lawyer, or you can also report them to the Board of Nursing, right? Because that's the way they do it as well. And I'm gonna tell you, some people don't belong in an instructor role anymore. Their asses just need to go retire, go chill out on the fucking beach somewhere, right? But it's hard to get staff in schools, just like it's hard to get nurses to stay bedside or to even go bedside, right? It's hard all around. So they don't pay nursing instructors enough. They don't pay staff nurses enough either. So, but hey, hopefully, those things are going to change. The hospital have no stable nursing that all travel. Yeah. I work OR tech for 16 years in surgery, and I've been trying to get into nursing school, but some people say it's easy. So I've been a surge tech since 2010. And let me tell you something right now. To get into nursing school, you just got to go down the list of the stuff that they want. You apply. And I'm telling you, as a surge tech, for 10 years, for somebody who had 2 deployments, one as a surge tech and then one as a basic corpsman, as an LVN, nursing school is not as easy as you think it is. It actually became harder because of all the knowledge that you already have, because you bring real world stuff into a perfect world scenario. Okay. So I got that, but thank you. Okay. No worries. Misha said, I passed my first time taking the NCLEX for my LVN license. I have test anxiety, so I didn't do it. What? I pray I don't choke no, don't pray. Here's the thing, that if you get into a routine and you prepare for your NCLEX like you have been practicing, you're going to go in for that exam the exact same way that you practice. Langley said, will be more content added to your course, or will it stay the 7-day course? So more content is getting added. That course is, so I'm going to be adding content essentially like forever. But what I'm saying is that it's going to go away. And then eventually it's going to go to a subscription base, right? So anybody that buys the course now, you're going to have it forever for however long I update it. Okay. Caribbean said, yeah, they need to go. And yes, staff is short and there's facts. I know that because the schools that come to the hospital, they said the instructors, I talk to them and they say that all the time. The school I'm attending now actually was fined and sued due to them weren't allowing back. That's what I'm trying to tell you. They wild out here. In Texas, I read on the BON that they can waive the CE requirement for your first year. That is correct. David, you are very much correct. They will waive it. I actually just had that conversation with somebody else. And then when it happened to me, because I got my license in 2020 and I had to renew my license in 2022 or 21, and I didn't have to pay anything for it. What's an LVN? I keep hearing, or you are saying. So an LVN is a licensed vocational nurse. It literally is the same thing. It's just that the names are different. They same job, same everything. It's just depending on where you live, they're either called LPNs or LVNs. That's all it is. Thank you. I'm new here and I really enjoy it. I appreciate it. Is it Deetra? Deetra. Drita. There you go, Drita. I appreciate you being here. Hey, make sure you like, share, and follow, of course. Just want to be sure I still have a year till graduation. Of course, absolutely. So you have a year till graduation. And here's the thing is like, I'm a man of my word. And usually when I see people that are on there, they'll be like, hey, I bought your course, but I don't see it. Okay, cool. I'm only one person. Give me time. Let me see what's going on. Boom. If I see you pop up on there, because I will see it, I'll be like, all right, cool. Langley has it. Let me double check. All right. So Langley, you going to get it for $48. And I promise you it ain't going nowhere. Only thing you're going to see, like right now, I have 42 content videos in there right now. And right now I am editing my new generation NCLEX review, as well as the 7-day review that breaks up in management of care, pharmacology, so on and so forth. So I have them broken down in sections as well as the NGN, right? So those are in there. I graduated with my RN. I graduated with my RN in 5 weeks. Okay. The hardest 5 weeks ever. It's hard 5 weeks because you're towards the end. I got Mometrics SEA2 prep book. That's the one you're talking about. Yes. Yep. That's the one. 5 weeks to my LPN. Shout out to you, Amanda. Yes. Okay. I'm spending way too much time on TikTok. Heather, it's because you love being here and you love watching me talk. Stop playing games. I recommend that you take your NCLEX as soon as possible. I agree. Do not wait. Some people are just like, well, I'm going to go on vacation for a week. Fuck that vacation. You better fucking study, get that license, and then take your ass on vacation. Stop playing. Langley says, thank you. I'm going to sign up now. I appreciate you, Langley. And the thing about it is like, people out there just like, hey, don't buy it. He's a scam. Bro, I'm right fucking here. I'm right here. If you go to all my social medias to include YouTube, Instagram, TikTok, fucking Twitter or X or Thread or whatever, bro, I am right fucking here, right here. Not a scam. I ain't gonna be like, hey, give me $1,500 and I'll give you all of the guaranteed questions on NCLEX. No, fuck all that. Do I look like Operation Nightingale? Do I look like I want the FBI kicking down my door? Absolutely not. Do I look like a Florida or Georgia nurse? No. I'm sorry. Shout out to all my Florida and Georgia nurses out there. Hey, I just want to let y'all know that was a very real thing that was going on. So, okay. Well, I had a meltdown in my patho class. My work was lost and I'm averaging a B. Look, man, as long as you're passing, don't even matter. As long as you're passing, don't even matter. As long as you get into nursing school, don't matter. As long as you pass and graduate nursing school, don't fucking matter. Don't matter. I failed NCLEX 3 times. You know how many fucking Do you know how many tests I failed when I was in nursing school? At least 1 or 2 per class. I swear to God. I swear to you. I took mine 2 weeks ago after mine. Okay. Thoughts on Archer or UWorld? So user 75, both of them are good. It all just depends on you. UWorld, they don't give content. They give their questions and in-depth rationales, which I think are good. But if you have a content deficit, you may need something more. I like Archer. Archer, they have videos and they have questions, and I think they're great. I think they're pretty good. So either one, it all just depends on what you need. Do you need content? Archer. Do you have a good understanding of content and you just want questions and answers? Go to UWorld. But you could do Archer. They're both interchangeable. You know, come to Tennessee and teach nursing RN, ma'am. No, I will not. I'll teach anybody over the computer. Actually, I thought about doing like a live NCLEX review. I hate doing it. if I did a live NCLEX review, it would not be 7 days. It would be over the course of 3 days. But I hate those reviews because it's so much cramming, right? So I'm trying to figure out some stuff in the future. I thought about kind of doing maybe a weekend, like resort type of deal where we could talk about not only just NCLEX and not about nursing, but mentorship and stuff like that. Those are things that I have planned. You see that whiteboard up there? All that shit's up there. It's coming. Farmer's daughter, man, we are farmers. Dum, dum, dum. I mean, hello, ma'am. How are you? Deb, I rescheduled and study. Jill, you rescheduled what? Victoria, you're dead. Hey, look, you already know I'm a clown out here. Were you live? Just curious. What do you mean, TJ? Tell me. What's up, Nikki? How are you? And it's all because of Nikki in my dream voice. You see what I'm saying? Drita says, thank you for all the information. Have a good night, dear. Next time, what day? Oh, so my next live will be Monday at 5:30. So Central Standard Time or Texas time. You just called me dear, so that kind of just told me where you fall in the age range. So I appreciate you being here. And yes, ma'am, we will be we as a collective, we will all be here on Monday. It's me, Jessica. Don't you recognize me? I'm playing Stace. But what's up, girl? How are you? David said, I studied a little bit every day for a month and a half, then took the day off before the NCLEX. Yep, I would agree. I would agree with that. Some people, so David, you already know some people are different. Me, I was hard-headed. I had a lot of military and medical background from being an LVN or LPN, as well as doing surgical tech and teaching, so I was hard-headed. I had to throw the real worldness out, and I had to bring the fake world in, not the fake world, but the perfect world. So I had to do all that. So you and Archer helped me pass the NCLEX first shot. Colette, when did you pass? When did you pass? Hi, my first exam in mental health, I got a 52%. My second exam, I got an 82%. Will buy your book. So I don't have a book. I do have a program. And as a matter of fact, I actually have, I'm working on, when I tell y'all I'm working on content, it's going to be like 150 videos, y'all. It's going to be 150. And my psych section is probably going to have about maybe 5 to 8 videos in there. And my videos they are not long. And by long, I mean each video for whatever the topic, I try to keep it under 30 minutes because who the hell doesn't want to sit for half an hour if they're on a lunch break or whatever and they can watch a video and be like, oh, okay, cool. I learned that. Boom. You know what I mean? You don't learn to nurse until you get into the real facts. You don't know how to actually function as a nurse until you start working as a nurse. That's why time management is very important. That's why I say get time management down now because you'll be able to apply it when you get into school, when you start in clinicals, and then when you start working as a nurse when you hit the floor. Give us one more nursing scenario question. Jill, give me a second. Give me a second. Let me think about that. You don't learn. I passed. Yeah, you did. Colette, did you tell us that though? Did you tell me that? Because you already know I would have given you all the flowers for that. But then again, that was in July. And I don't know when you did that or whatever, because I know I was gone doing all kinds of other stuff. So it says, drop that link so I can get the stuff. I'm going to say, nah, Kevin said, what you mean? Wait, what happened? What did I say? What did I say? Hey, if you guys are just joining, we are talking about nursing stuff. We're doing an Ask Me Anything. I'll probably hang out here for about another 20 minutes. Okay. So whatever questions you guys have, drop them down below. Also, I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, hey, drop your 2 cents. Let us know what you're doing with your life. I didn't tell you, but you're the truth. Colette, I appreciate you. Hey, so here's the biggest thing that I love is where you guys come in here and you guys tell me that, number one. And then also number two, you guys like telling other people. I had somebody buy my course and then message me and said, hey, I need help. And I was like, okay. And so I took time out of my day, 15 minutes. And I talked to him and he's from Ethiopia, speaks like 6 different languages. He failed it. And, he just needed a little words of encouragement. And sometimes that's what people need. And I love giving that to people because I knew where I was when I didn't feel like I had, a good support system. My goal is to try to be the support system for fucking everybody going through that journey because I know how it feels. I want you to think about it. If you go to Archer, Hearst, UWorld, Kaplan, all these big people, all these big reviews that are out there, name one of them that tells the story of them failing their NCLEX. Because everybody sits there and they say, you don't want to fail it. Okay, You're right. I don't want to fail it. But what is going to happen if? Because there is always that if, right? What is going to happen if? Hey, we'll give you the shit again. Okay, but you give it to them again, or they give you a refund, and then you take your money and you go somewhere else. But you still haven't fixed the problem. Sometimes you need some recalibrating. Sometimes that's what that is. You know what I mean? I can tell you right now in this space of creating an NCLEX course and doing coaching and mentoring, I have not heard not one person say, "Hey, I failed it." Me, I don't care. I don't give a damn about what nobody think about me. They'll be like, "Oh, you failed it. You're not a good coach." The fuck you mean? My testimonies say differently. You know what I mean? But it's also about the fact is like you gotta really want to teach and coach people, and I really, really do. You know what I mean? So they got the reviews out there. It's just all about how you approach them, and then also trimming the fat and auditing yourself to figure out what you understand and what you don't understand, and then pushing forward. Okay, let me see what you guys said. I know you guys were talking while I was rambling in my mouth. I didn't tell you, haha, but you're the truth. Oh, yeah, we talked about that, Colette. How do you prepare for dosage calculation? Honestly, Happy Mom, it's practice. Practice, 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 practice. Colette said, I start my first job, but quit because of anxiety. Any tips to get over this? I panic knowing I have lives in my hands. Honestly, Colette, you need to really go to a level 1 trauma facility and look at their residency program, and then you got to ask questions. You got to put yourself in those situations, and you got to get over that hump, right? Everybody in their first anywhere 6 to 9 months of nursing gets into imposter syndrome. Even after a year, like, why am I even here? I don't learn anything. But we got to get over that hump by continuously doing, not staying stagnant, not quitting. We got to see it through because that's how you learn. You got to be put in those situations in order for you to adjust to them. Okay. And I understand your anxiety. There's one girl who I worked with. She had to take anxiety meds in order for her to work. In my opinion, if you have to take anxiety meds in order for you to work, you might want to think about something else. Not saying, because it's just like nobody wants to be on anxiety meds so they can work. Like work shouldn't be that way, but work is work. You know what I mean? But me teaching and coaching doesn't stress me out. Me creating a course doesn't stress me out. You know what stresses me out? Deadlines. That's what stresses me out. But other than that, like I don't have to worry about, I don't got to sit here and look at a fucking cardiac monitor and be like, okay, PVC. Oh, that's a run of VTAC. Whoa, hold on. And I look at them and then I got to check. Pulse, a pulseless VTAC. Like you fucking pulsing over here. All right, now I got to code them, or whatever the fuck is going on. You know what I mean? So if you have anxiety, ma'am, I would 100% most definitely say take care of yourself first. Take care of yourself, okay? What does it say? From Texas, been a nurse for the last 4 months, straight out into the OR as a circulator and loving it. David, I know you do. One patient at a time, baby. One patient at a time. Thoughts on growing into CNA LPN in school, or going into a nurse, or go straight school to get my license. So here's the thing, Trip. This is for you, Trips. It all just depends on how your pockets are, right? So if you want to go CNA, do that. You want to go CNA, get to dip your toes in to get experience, cool, and then go LPN. There's people that have done that route. Went CNA LPN to get their RN as an ADN, and then they went to go get their BSN. There's people that have done the route. There was a girl who was a janitor, went from janitor to being a phlebotomist to being a CNA, LPN, RN, masters, and now she's a CRNA. You know what I'm saying? So it all just depends on you and what you want to do for yourself. But it really does depend on how it is financially, because these schools out here are expensive. Growth mind, failure is an opportunity. Here's the thing, what I like to say, we are all unsuccessfully successful. We are all unsuccessfully successful because you are not. First of all, if you came to me and you were just like, I always get the answers right, I'm this, I'm that. If you got nothing but 100s in school, I would tell you to get the fuck away from me, because it's just like, where is the humanistic, where is the realism there? You know what I mean? Growth mindset. Right? Failure is an opportunity, right? You're unsuccessful at things, but then you eventually, if you keep working at them and you trim the fat and you audit yourself, self-reflection, you eventually will be successful about it. That's why I say we are all unsuccessfully successful out here. David said, I have imposter syndrome so bad as a new nurse. And then, David, it's going to be like that for the next probably 6 months. Probably 6 months, but that's okay. That's okay. And if you're 4 months into your program, I'm pretty sure you're on orientation right now, because I think orientations are like 6 months for OR nurses, if I remember right, or 4 months or whatever. You're going to do just fine. Hey, you already know time management, but remembering your times, right? Room time, anesthesia time, prep time, timeout, positioning, all that stuff, right? This is for you, David. I got you. I know where you're at. It might have been my facility. They didn't have a residency program and no steady education. Colette, definitely go there. Failed once, went all the way to 150. My second attempt is about in 4 weeks. I'm telling you right now, I did 75 questions and then 265 questions. And this isn't to me to be like, oh, well, my shit was worse than you. But I understand what we call going the distance. It's wild out here. So now you failed once. Now I need for you to go to your NCLEX breakdown, and I need for you to break that shit down to see where you didn't do well at, and then that's where you need to start, and then that's how you need to move forward. Okay. TJ said, I am on medication, can't do a lot for my anxiety. And it happens. You have people that are like that. Words of wisdom for upcoming RN new grads. Anthony. There's so much I could tell you. First thing I'm going to tell you is don't let people play with your license. And by play with your license, by putting you in really crazy situations. Next thing is you're going to have imposter syndrome. It happens to everybody. Within the first 6 to 9 months, you're going to have it, and it's going to be bad. You're going to feel like you don't belong there. You're going to feel like you're dumb. You're going to feel like you're going to feel those things, and that is normal, right? But my recommendation for that would be to talk to other people that have gone through the same thing as you and that are compassionate to understand of you going through that, right? That's why I love doing TikTok. Like, if you got a problem, you had a bad day at work, come over here and talk to me. Let's see what's up. All right, we can fix that. All right, you know what I'm saying? It's okay. It's okay for you to feel like that. You know what I'm saying? The next thing is be a sponge. Learn everything that you possibly can from your preceptor. Ask questions. Ask it twice. Ask it 3 times until you understand it. If you have them telling you, stop asking me questions, you tell them to go fuck themselves and tell them to answer your question so you can be the best nurse that you can be. All right, you probably don't got to say it exactly like that. You know what I'm saying? But you get what I'm saying. And anytime there's an issue, anytime there's an issue with a preceptor, with a manager, with a charge nurse, with another nurse, document it. And by document it, I mean write it down. And by write it down, I mean put that, like, even if you have to write an email to yourself or write an email to the charge nurse, write it to the manager. I don't give a fuck what you do. You write it. Right. That way, if somebody tries to retaliate against you or be stupid, you're going to be like, look, I've told you on 4 separate occasions I was having a problem with this individual and there was nothing that was done. And they can't say that they lied. And you'll have hospitals that'll try to tell you don't send your messages or emails to your supervisors or anything. Call them on the phone or go see them in person. Don't you fucking fall for that, and don't you do it. OK, I don't mean to be pointing at you like that, but you know what I mean. That's my words of wisdom for Anthony. If anybody else has any words of wisdom for Anthony, drop it down there. Hey, if you guys are new, jumping in, we're talking about, nursing stuff. I want to know who you are, where you're from, where you're at in your nursing journey, and what questions you guys got. God's favorite. My little sister got straight A's in nursing school, and I just don't get how she did it. So your straight A's in nursing school don't mean that you'll be a good nurse, but that's no shade on your sister for, having high academics. The residency program in the hospitals are nice. They teach you and walk you before you run. That's great. I'm glad that you had that, David. I'm really glad, because some of these hospitals, when I did my residency program in the ICU, I had 9 preceptors. Go over and y'all check out the series Why I Quit the ICU. And trust me, I still got other stuff to put in there. So Misha said, I started in a rehab long-term care facility because I love my geriatric. Now I am also at the hospital. I like it too. Okay. I need a tutor for school. Someone help. Is it Kay Brucey? I don't know exactly who can help you through school. I just specifically do NCLEX. Like, that's where, I guess like my area of where I focus. And my Isha. Oh, my Isha. Yeah, like Mo Isha, right? Mo to the E to the. All right, I got you, my Isha. I did. You're right. I did. All right, y'all. Hey, I'm going to hang out here for about another 10 minutes. What other questions do you guys got? Hey, I know it's Friday and I still got 50 something of y'all in here still rocking with me, because I know y'all about to go out and do something so fucking important, when in reality you about to sit on the couch and scroll on fucking TikTok all day. Stop playing with me, because I know that's what y'all about to do. So I am from, what's MS? Is that Missouri or is that Mississippi? That's Mississippi, right? Yeah. I'm in my first semester and I've been struggling. It's so hard. I bet. Your first semester nursing school will humble that ass. It will humble you real quick, right? I had a classmate of mine who had to switch out of the ICU when he started. He couldn't handle it. So here's the thing, is that the ICU does move very, very fast. It really, really, really does. But what will make or break you is your preceptor. I promise you that. In the ICU, I ended up getting a good preceptor. Oh my God, when I tell you I loved her, she was so compassionate. She was so willing to teach teach me offline and all the other shit. And then next thing you know, I was like, hey, can I work with her? They were like, no, we need to put you on nights. And I was just like, what the fuck? So that's just another thing. I talk about that. Time management is key. Facts. Time management is your best fucking friend on in nursing school. What it says, do you think all RNs should start a med surg? I do not, Langley. I do not. Brucey says, yes, I'm definitely humbled. I never struggled with schooling until now. I need a tutor. Hey, and I don't know how the free tutors, I mean, they have tutors out there, right? They're definitely start looking on YouTube at free YouTube channels for sure. Like I said, I don't do tutoring for tutoring for nursing school. I just do tutoring specifically for NCLEX. Kev, how did you decide to get on this platform and ultimately give back to our baby nurses? Ma'am, I will tell you that right now. So when I wish there would have been something like this, or I wish I would have found something like this when I was in school, right? And Barb, a little bit, I just called you Barb, like we're cool. I would call you Barb. But a little bit about, I have a teaching background, and I always would go above and beyond for students that I had to make sure that they understood it and understood it in layman's terms. But I also have a military background, and mentorship is all I know, because we have to teach the person to the left or right of us, in order to save lives. Like, I've been deployed, so I had to teach people that don't have any medical background how to sustain and save somebody's life before. And I'm a combat instructor, I'm a tactical combat casualty care instructor. So I've had to teach these things to people, and I want to be able to give back to people in order for them to go out there to give it to somebody else. I genuinely mean that. I genuinely mean that, because people be out here trying to hoard knowledge, and knowledge is free. Granted, time is not. There's a big difference between knowledge and time, right? Now, if you believe in somebody's knowledge that they have, you'll pay for that time, because time is the only thing that we can never get back. I can replenish money. I can replenish donuts. I can replenish cheese, pizzas, because that's what I like. But but time we cannot get back. So that's what I love doing. I love being able to do this because of questions like that, number one, and then the reactions and the talking, conversing back and forth is what we do. So that's why I like doing it. MedSurg is a great start. However, you are not required to go there. And I tell people, go to where you want to. David said, I'm getting kicked to evenings, nights as soon as I'm done with orientation. Of course you are, because that's where they send all baby boot nurses. That's where they send them. You deal with different disease processes. Yeah, you do. Why do I find critical care concepts more easier than MedSurg? Aaron, Aaron, that's a good question. I don't know. Because I like critical care concepts as well. Especially when it comes to I love hemodynamics. I love hemo. I enjoyed the classes when I went to them. I wish I would have got hemodynamics before I started working in the ICU, more in depth, but I got it in the middle of ICU. Vent management, love it. Love it. The critical care aspects of how people decompensate, learn the critical care concepts when it comes to somebody who has a pulmonary embolism. It will blow your fucking mind. And I'm telling you, during COVID, and look, I've seen my fair share of pulmonary embolisms. I've had enough of those to last me a lifetime, and probably about maybe out of all of them I've seen, I think I had one guy that survived, and that was a wild day. I dropped out of school, but about to go back in now. Exotic Barbie. All I want to say is beauty school dropout. Anybody? Greece? Whatever. I'm on my own. Brucey says, okay, thank you. I'll be back for the NCLEX. Ma'am, you ain't got to be back for the NCLEX. You can stay. You can stay here. We do these 3 times a week and get this knowledge. Who is that? Exotic Barbie, did you follow me? Ma'am, I'm going to need for you to follow me and stop playing games. Langley said, I got accepted to my job as a CNA on a cardiac floor and no clue what I want to specialize in. Langley, if you don't know where you want to specialize in, go to MedSurg. But let me be very clear. MedSurg is also a specialty. Okay? Don't get it twisted. Who is that says, I love the increase in male nurses too. That you may see an increase in male nurses where you are, but male nursing is still 11%. And women are, female nursing, which is female dominant, it's 89%, right? Who is it says, is it need to? It says, I'm a nurse from Nepal. I completed my bachelor's degree from Nepal and I now live in Portugal. Man, that's awesome. Apparently I must be popular in Nepal or in Portugal because I've had so many people from Nepal come in here. I love the reach that we're getting here. I am at a crossroad. I love teaching, but I also love leadership. Barbara, let's talk about it. Let's talk about it. I also want to do NCLEX. You want to do need to? What exactly about the NCLEX you want to do? All right, it says no. I went to Greece also. Okay, good. I'm not the only one. But Barb, let's talk leadership. We can talk leadership. You can also do education as a leadership. I think that's what you said, right? You said something about education. Let me just make sure. Let me double check. Shout out to all y'all that are in here. Oh, you're at a crossroads. You love teaching. So you can do both. You definitely can do both. But I like leadership. Now, I think you're talking about maybe traditional leadership of being in a position at a hospital, but leadership doesn't have to be in the form of being a manager or being a director. You can make the same impact not even working in a hospital. You and I both know that. You and I both know that. And I'm not currently working in a hospital right now, but I know by me doing these things out here for people that if I was just like, hey, I'm going to be going to fucking, I don't know, I'll say, I'm going to meet everybody at the Alamo, in 4 weeks. I want everybody to come out there and hang out, and we're going to form a school circle, and we're going to talk nursing mentorship and nursing leadership, and we're going to do, an impromptu NCLEX review. How many people you think are going to show up for that? How many people you think are going to show up for that? That is the teaching. That is the leadership. That is the mentorship. That's the stuff that you can do for sure. Because the one thing I learned about the military is that you don't have to be in a leadership position to be a leader. You know what I mean? And that's one of the things that they tell us. They were just like, if I'm senior to you and I'm doing something wrong, tell me, hey, so-and-so, I see that you're doing this, according to this and blah, blah, blah. And you get checked. I've been checked by my junior sailors a lot. They be like, hey, H1. I'm going to be like, you're right. That's my bad. You're right. That's right. That's my bad. And you got to be a humbling person to do that. That's what I'm saying. With leadership, you don't got to be a director of nursing to be a leader. The fuck does that even mean? You know what I mean? So let me see what y'all are talking about. You make me want to teach. I teach all of my patients about the disease and I love it. Maisha, let me tell you, when I talk about disease processes and how everything's going, I actually grab a dry erase marker and I will draw it on my whiteboard. My name and stuff wasn't on the whiteboard, but when I talked about a chest tube, it definitely was on the whiteboard. No, but I do that all the time. And I literally have had patients and their family members saying like, oh my God, you were so smart. Why didn't you become a doctor? And I was just like, doctors do medicine and nurses are patient oriented. And they were like, whoa, okay. All right, that makes sense. It's interesting you say you have a military background. A lot of my coworkers are former military. How is that interesting, David? Oh, Maisha, you come to that impromptu NCLEX review? That's actually cool. I'll be there, but can we go somewhere else instead of the Alamo? Kind of like, ma'am, Steph, don't do that. Don't do that. Hey, don't do that. I like the Alamo. I'm a big history buff. That's why I like the Alamo too. So, but I am in a leadership position. And I want to be that hands-on preceptor. See, now that there's the crossroad. Okay, now I see the crossroad, Barbara, that you're talking about. I really don't even know how to handle that at your level of being in a leadership position, because you already know if you're in a leadership position at a hospital, there's meetings that you got to go to where they talk about fucking nothing. There is, unless you can do it as a leader, you can separate your time, because as a leader, they're going to make you charge, right? Or they're going to make you manager, or they're going to make you director. Once they pull you out of once they pull you out of the worker bee role, that's it. Now it's just like, how can you rechannel your leadership and how can you redo things? They're still there. They're still there. OW says, I want to teach too. After I get my experience, I want to have my own CNA and medtech school, baby. That's what that's what I call goals and ambitions. And here's the thing. If you want it, let's change up the verbiage. Because if that's what you want and you're saying it out loud to me right now, go ahead and change the verbiage and say, I am going to teach after I get my experience, and I am going to open up my own CNA and medtech school. Speak it into existence. Put it out there in the universe, and it shall be so. You got to put that work in, though. You got to put it in. Trust and believe me. I said that I wanted to be a coach. It took me 3 years for me to find some type of footing. I said I wanted to create an NCLEX course. Definitely one of the hardest things that I've ever had to do. And I've worked more doing this in my entire adult life. So you can do it. Trust and believe me. I felt super validated today because my instructor recognized my effective patient care education skills. Look at that, Steph. That's what I'm talking about. That's what I love to see. That's what I love to see. I love when you guys come in here and tell me all the positive things that you guys that happened to you, while you guys are out there doing your thing. So I am the director of surgery. That's where I struggle. I love to watch our newbies see the light, and I love that. I love that you love that. I love that you love that. I had a really good friend of mine who was the director of surgery. Of course, in charge of OR, PACU, pre-op, all that stuff, right? And I liked his leadership because it was more military. And then we got a new director, and she's great too. Like there's no shade against her, but she was great too. But like I said, you already know they're gonna keep you as a director, and that's the thing. Is like if you're in that position. And I say this to you, Barbara, if you're in that position of being a director in the for surgery, you must be one hell of a leader to be in that position. I see people that are in those positions are not. I've seen some people in those positions that don't fucking belong there. And I've literally told people that are directors, and it's probably my military leadership, and I probably should kind of tone down on that because not everybody understands that bark, right? And then, I end up in HR. So you damn well belong in that position, but that hinders you because you want to still be able to do that. So my suggestion, coming from that is finding something that can implore you to teach people. It doesn't necessarily have to be, there. What is something else that you like to do that you can, funnel that preceptor educator aspect to? Remember, think about it. You can have somebody see the light if you put on a PowerPoint presentation and you teach them and you tell them by experience, or creating videos for them or something along the lines of that. It's all about this point. It's just thinking outside the box when it comes to anything leadership, teaching, as well as, all around nursing. Right. Hey, shout out to everybody that's in here listening to me run my mouth. We're talking about just nursing school, before nursing school, NCLEX, working as a nurse, imposter syndrome, you name it. That's what we're talking about. I want to know who you are, where you're from, where you're at in your nursing journey. This is what we are doing today on this Friday. Y'all could be anywhere else, but you're here with me. And I appreciate that. And I said I was going to get off, but now me and Barbara are just having a conversation. So what questions do you guys have? Hey, so just to let you guys know, I do have an NCLEX course. It's $48 and it's for a lifetime, and it's in its pre-launch phase. It is going away on Black Friday. Okay, it is going away on Black Friday, and another deal it'll still be a deal, but that deal will be there. Okay, I like the PowerPoint ideas videos. Maybe I make those. I'm just saying, it's just like, okay, think of a hobby. Think of a hobby, Barbara, that you like. Okay, let's just say you like, this is probably just me. Let's just say you like knitting or crocheting, right? And you wanted to, I don't know, create a course or have a little workshop of everybody that like knitting and crocheting, but everyone that also like being a nurse. You see what I'm saying? So it says a permanent ban will be insured if your live video does not end within 2 minutes. Oh my God, I have to end it in 2 minutes? Hold on. Bro, literally somebody came in here and said that they were going to ban. I hate people that do that. I was like, I've been on this live forever, bro. What did you mean? So, hey, I like both. Barbara, I just said knitting just because, but I think about it. You can really impact somebody based off of the hobby and their occupation, and effectively, get through to them on a mentorship and a leadership position. Like one of my preceptors, she is now a cardiac nurse practitioner. Anytime I have any questions about anything, I'm just like, hey, I got a question about this. She's just like, what's up, baby? I got you. Another one of my really good mentors and preceptors, she is a pulmonary nurse. She's an acute care nurse practitioner, and she's fucking awesome. Like her and I are like really good friends, and she teaches me all the time. Hell, I even have her look over some of my fucking lectures and be like, hey, am I dumb or what? And she's just like, no, this looks really, really good. You know what I mean? So it all just depends. Like how you can channel that. From Arkansas, working on my MP. Shout out to you. Is it Antoinette? Hey, I like both. I wish we had nurses in East Tennessee that want to teach us. They all treat us like the plague. Langley. I'm laughing because you said it's the plague. So I'm sorry that they treat. And you know what's really, here's the thing, is that it's like that across all nursing schools, every single one of them. How often are y'all writing out care plans in actual practice? We don't. That's only a school thing. Honestly, in my opinion, I feel like that's a very outdated thing. However, when you're in school, they always do. They always take you down to the fundamentals. It's to get your mindset so you can understand what nursing diagnoses are. You understand disease processes. You understand what's gonna happen at the beginning towards what's gonna happen in the middle and then the end of your shift. So there's a structure to it, but sometimes I feel like it needs to go away. Is it Carrie? Kari? Oh, what's up? It's Kari. It's Kari. Carrie. Party with Kari. Any tips for leadership class? So leadership is all about what? Leadership, management of care. That's delegation, supervision. So think about it. There are those little quotes like if you're for RN, don't delegate what you eat, right? You acute versus chronic, stable versus unstable. Who can do what? Know the roles and responsibilities of your UAP, the roles and responsibilities of the LPN. Honestly, that's what it's all about. It's all about making decisions about those things. When do you call the doctor? When do you assess? Right? Who do you see first? That's what leadership is all about. That is what it is all about. Appreciate your question. All right. Thanks, Mill. You're so helpful. You're welcome. I got you. Hey, for all 42 of y'all that are in here rocking with me, make sure you guys are at least following me, okay? I'm going to be starting to drop more helpful TikToks more often. Like I'm going to get these TikToks all chopped up and stuff. So that way they're at least beneficial for people out there. Oh, like I said, hey, anybody that needs NCLEX coaching, guys, check that out. That link is in my bio. Also, for like I said, 7-day NCLEX course, $48. It is going away. It is going away. Right now, it is $48. $48. A 4 and then the number 8. It's going away. So I'm just saying, make sure you guys go over there and check that out. If once you buy it, it is yours forever, and you're going to get all of the updates. That means the 7-day review, the new generation NCLEX review, which I go over like 100 questions. And then all of the important content. So pharmacology content. What else? What else is on there? Endocrine, respiratory, pediatrics, safety, maternity, all kinds of stuff is going in there. So I'm telling you, this review, this course is going to be jam packed, and y'all are helping me build the plane. Y'all are helping me go from spirit because. Anyways, y'all are helping me. We're going from Spirit and Frontier to Emirates Airlines, because that's what we do. Maisha says, I love being on your line. Ma'am, I love you being here. I appreciate your engagement. I appreciate you asking your questions. This is what I like. Is it Elise? Elise Page? The last time I saw the name Elise was on Assassin's Creed. So shout out to you. But anyways, welcome to everybody that's in here. But we're going over. Yeah, at least I know you know what's up. So, hey, I'm a big nerd. I'm a big gamer. I love anime. I love video games. I haven't played a video game since God of War, Ragnarok, which was in February. I take that back. The last game I played was Harry Potter or Hogwarts Legacy. So I'm just saying, like, I wish I could play the game, but, priorities and deadlines. Once I get my deadline and my priorities, and Kevin's going to give himself a break. But, of course, I'm here for y'all. You know what I mean? So shout out to y'all. Y'all got me to 24,000 likes. I appreciate every single person that is in here. But right now, I think I might call it a night. Would I be able to donate to you to help with teaching? TJ, you actually can donate to to the TikTok, because when you donate to the TikTok, like with the gifts and stuff like that, that actually helps out a ton. And my main goal is to start doing this stuff full time. Like, I don't do it full time because I still have a job, even though, I'm kind of like on family leave, but eventually I got to go back home. I'll go back home. I got to go back to work. But like, I want to do this. My goal is to do this full time. I'm doing this for full time. All right. So however you can, the best way to donate is to give the gifts on the live when I'm doing them. Barbara says, so Kev, food for thought. How do we keep our nurses? The news this week. Barbara, let's talk about it real quick. So, of course, I'm taking mental health right now. Veronica, what's wrong with mental health? I want it to get to you. Oh, okay. How about this? Maybe I will start like a Venmo, or I'll start like a Venmo or a Cash App or something like that. Like, maybe I'll start something like that. and I'll be like, hey, if you guys want to donate, you guys can donate to this. Maybe I'll do something like that. Okay, we'll try that. I ain't even got my mess together. Hey, I feel you, Veronica. But ma'am, Barbara, let me answer your question. If for y'all that don't know, there's been a lot of nurses that have been getting unalived, like home health type of stuff that's been going on. And there's a lot of that's been going on. And the one thing I'm going to say to y'all is to take care of yourself. Like if you're a home health nurse, or if you're a nurse that works in a hospital, like nurses in the hospital have been getting stabbed by patients, shot by patients, been getting SA'd by patients, So you guys definitely need to take care of yourselves. Now, Barbara, I know I feel like I'm beating around the bush. But the way to keep our nurses around here, I'm a nurse extern in San Antonio. Veronica, I live in San Antonio. So shout out to you. Shout out to the Riverwalk, long live the Alamo, bang, bang, shoot them up. Hey, they can come and take them all they want. Let me stop. But the way, Barbara, that they keep our nurses is to, number one, they need to give us safe patient ratios. That's the first thing that they need to do. They need to give us safe patient ratios. And they need to pay us. No, those are two. Those are the two right there. They need to give us safe patient ratios and they need to pay us. They need to pay us a fair wage. There should be no reason why HCA is making $6 to $9 billion a year, and then the CEO of HCA is making freaking $30 million a year. There should be no reason. I work at Maine Methodist. Yes, that part. I actually used to go to Maine Methodist because that's where my students would go for surgical tech. So I used to go there all the time. Hey, look, Veronica, I know all about parking in one of those parking lots and then walking into the parking garage and then walking under that long ass tunnel. Yeah, Veronica, I know what I'm talking about. You know what I'm saying? Absolutely well-spoken and mandatory. Yes, I believe that every person that assaults a nurse or a healthcare professional at any point while they're on the job, hell, it doesn't matter, that it should be, their asses belong in jail. They belong in jail and they should be freaking, punished to the full extent of the law. That shit is unacceptable, right? How do you expect to keep nurses if you can't even keep them safe in the workplace? You know what I'm saying? Yes, nurses do more and physical therapy to help out, right? And think about the mental anguish. There's a reason why you have a 6 months to a year and a half turnover rate, or why nurses don't stay in a hospital. I was on call on call birth dual at Maine before nursing school. Oh, okay. I see you out there. Yes, especially if I got to get fired for fighting back. That's the thing. That's another thing. It's just like, I'm just going to let you sit there and stab me. All right, cool. Hospital's not going to take care of me. I don't know if you guys remember, there was that one story where the cop arrested the charge nurse because she told him, per their policy, I can't let you draw blood on him even if he has a DUI. And then they arrested her, and then she ended up winning like $300,000 like from the city. But it's just like, bro, you arrested her, you assaulted her. Like, are you kidding me? So, safe ratios, and they need to fucking pay us. I got picked up by a veteran PTSD by my hair. Took 8 staff to get him to release me off my feet. That shit's wild. Like, and here's the thing: is like I'm in the reserves, like, and I'm a veteran. You know what I'm saying? So I see. It is wild out here. That's why I always tell women, hey, don't be coming out here trying to fucking find a baby daddy in the hospital. You know what I'm saying? Fucking wrap that fucking nest up and don't let a motherfucker be trying to grab your hair, okay? So, Vandy thoughts. Oh, are we talking about Redonda Vaught? Is that what we're talking about, Barbara? Oh, I'll talk about her. It says right now my clinical rotation is at Northeast Methodist. Look, okay? I left bedside to become a school nurse and I still get attacked. And we are still short-staffed. Alexa, oh shit, my shit's about to go off now. You're a school nurse, Alexa. Who do you get assaulted by? Besides the little ankle biters, because they're kids, and I expect kids to lash out. Barbara, here's what I'll tell you about Redonda Vaught. That woman does not deserve her license, right? I hold Vanderbilt responsible for them bringing her and then charging her with murder after that. But she 100% does not deserve her license. Like, you don't override a Pyxis, even though it was a norm, and then get Vecuronium instead of Versed. They're two different classes of drugs. One has to be reconstituted. I have been stabbed by a student. Ma'am, where do you work at? Do you work like in a baby hospital? I mean, a baby hospital, like an elementary school, a high school? Like, what are we talking about right now? Hey y'all, love. I can't stay. Got to get home. Wanted to give you some likes and love. Army nurse, ma'am. I appreciate you. I appreciate you. But 100%, Redonda Vaughn does not deserve to have her license back. Like, here's the thing: you can do 1,000 things that are great, but you do one thing where somebody is not here with us anymore. That's enough for you to not have it. Right now, do I think it was? Do I think it was right for the hospital to bring her back after like whatever a year or 2 years or however long it had been to prosecute her because somebody whistle blew about the hospital being a piece of shit? Absolutely not. But she does not deserve to have her license back. I don't care what nobody says. Like I'll stand on all 10 toes on that one. I've been. I got hit with a HIV needle. Oh no, 6 months of antivirals, clean but scary. I got stories. Look, Trace, I got stories for you too. I had people try to spit on me. Literally, I dodged it. Literally, I've dodged a whole lot, but I can tell you right now, I've been shit on a lot. Elementary, that's wild. That's wild, Alexa. These kids need to be checked out here. Hey, definitely be safe out there because we have no idea what these kids' home lives are like as well. So, I pray for them and I pray for you. So you definitely stay safe while you're working with those kids. Trace says, thank you for your service. Thank you for your support. I appreciate that, Barbara. Like where I was stabbed or what school? No, I don't want to know your school. Book deal. We should all go in. What? I should do a book? I should write a book? Oh, a book deal. Hey, so there is a good book. Hold on. I'm going to show you right now. I'm going to show you right now where it talks about stuff like that. Yo, so check this out. So it says special education kids don't get held accountable. I love them, but they're also scary. Yeah, there's a double-edged sword when we have special needs children for sure. Trace, it says I can't do peds. No way. I can't do babies either. I can't do babies and I can't do psych. Nursing is the most abusive profession for real. Heather. Hey, so here's the thing. Me and Heather, tell them. Me and Heather got stories. Me and Heather used to work in the same ICU together. We used to work in the same ICU together. And I'm telling you right now, if I'm lying, I'm flying. And Heather can co-sign on everything that I told y'all. I'm going to write one. So this book right here, right? It's called The Nurses, right? It says A Year of Secrets, Drama, Miracles with Heroes of the Hospital by Alexandra Robbins. It talks about different nurses' stories, right? This book, if y'all don't have this fucking book right here, that's a book that y'all need to get. Get it on Audible and listen to it. It's wild. It's wild, the stories that they talk about. Oh, my book. Oh, I should write a book. Oh, I am going to write a book. I actually have 4 book ideas, but one thing at a time. One thing at a time. My specialty is mental health and geriatrics. Okay, shout out. Oh, yeah, you did say something about psych. Oh, I'm going to go check it out. I'm telling you that book is really good. But yes, Veronica said something about I am going to write a book. Like I have 4 book ideas. So like I have a lot of things that I want to do over the next 5 years. Like I have a 5-year plan and I promise you like all that shit's going to get done. All of it is going to get done. So watch. I want all y'all to be on the journey with me because Veronica going to be like, he said he was going to write a book. Trace said he said he was going to write a book. And there it is. Right. So I got I'm telling you, the plans out here are going to be great. My plans that are going to be that reality. All right. But yeah, I would definitely recommend that book. Thanks. I will get it. I like to learn from book. That's a great book. Don't get me wrong. I'm so happy I switched. I actually feel supported by man. That's good. That's good, Alexa, that you feel supported by management. And here's one thing I will say as well, is that the managers that I did have when I worked in the ICU, they were very supportive. They were very supportive. When I said I was going to leave the ICU, I left. I mean, I didn't leave. I told her and I was like, hey, I hate this place. I'm going to quit. She's like, oh my God, why? And I told her why. And then she was like, well, I would love to keep you. You know, you're a wonderful, you're a fantastic nurse. You're a great asset, but I want you to go where you're happy. That's exactly what she said. So all love to her for real. And then, my other manager, when I worked in the, freaking, oh my God, in the burn ICU, wonderful. When I worked in the OR, great. You sound like a creative or a create entrepreneur. Barbara, I would say that I have my entrepreneurial journey started like in 2020, like the day that I got my license. But I didn't like, it's weird. It's like when you go on a different journey, this is for nurses. And I tell everybody, it's just like, you don't have to have a license as an RN and work bedside. Just because you're an RN doesn't mean you work bedside. You can go out here and you can create your own. I mean, I want you to look at all of these NCLEX reviews. They're all created by nurses. I want you to look at like these flashcards. They're all created by nurses. I want you to look at these clipboards that you can buy off Amazon, the ones that are foldable and it has the cheat sheet stuff on it. All created by the nurse. So you're a baby nurse. You don't sound like it. So, I have my military background to kind of speak up on that. Or not speak up on that, but I guess you can kind of hear it in my voice. I was an LPN, or I'm a hospital corpsman, which is equivalent to an LVN. And I did that I've been that for since 2007. And then I became a surgical tech. But in the Navy, you still do everything. So I was a surgical tech and I was able to do other things as well. Deployed as one, and then I went to nursing school. It took me 8 years to become a nurse because between deployment, PCSing, and military responsibilities, that's how long it took me to get there. And I got there. But with all those steps in between, like the leadership, the mentorship, all that is instilled in me. And so all I do is just bring all of this that I've learned from my military life over to the nursing occupation. And I just feed that into nursing. So that's what it's all about. So, but yeah, definitely still a baby nurse. Only been a nurse, or what I like to call a boot nurse. So how, we talk about baby nurses coming right out of school, learning. People that come right out of basic training going to learn in the military, we call them boots. That's exactly why I call myself the boot nurse. It says, why go on strike to create change for nurses? That's why. Oh, why go on strike to create change for nurses? That's why you moved up quick. That's why. What you mean, Trace? I'm trying to understand the context of what you're saying. I'm a covert nurse too. I was in school when the first shutdown happened. It was crazy. Facts. It was crazy. Do you have an opinion on the RN NCLEX Mastery app? Sorry, I don't mean to sidetrack you. So I think the app is okay, but I always tell people, like, if you're going to practice like you play, you should be doing NCLEX questions and studying on the computer. But that's just me. Everybody works differently. That's the difference. Yes, Barbara, that is very much the difference. Some people are just like, how do you talk? So I had a very rough time when I left active duty to go work in a hospital. And I had all these people, these nurses that were rude to me because I'm like, the first thing I said is like, I had to look around because I was like, who the fuck are you talking to? And then they were just like, I'm talking to you. And I was just like, not like that. You're not. And then, people kind of, they kind of chill out quick. So, Nurse Aaron says I was a surge tech before I was an RN. I know that's right. Shout out to all my surge techs out there. Like NCIS Navy ships. So I've never been on a ship. I've been in the Navy 16 years and never been on a ship. And NCIS is a very real thing. It's not fake. They really exist out here. People ask me from all over London, etc., why are RNs going on strike? Not safe. Both parties. Facts. That is exactly why. However, once again, I'm very unbiased. Do I support strikes? Yes, I very much do, because that's the only way you can invoke change. However, I am all about anybody working in a nursing strike to go get them $180, $120, $110 an hour. I'm okay with that. And it is awful. It is it's awful, but it is necessary, right? But the thing about it is, like, who the hell is during a strike? Who's going to sustain that? Who's going to sustain paying all these strike nurses $120 an hour? Not the hospital. That's why they had to come to some type of agreement at some point, right? So a lot of people saying, like, oh, you guys that go on strikes, that doesn't invoke change. Okay, then why do changes still happen? Stop playing. Like, think about it. All right. I've been an L&D nurse and I'm ready for a change. Don't know what to do. Well, is it Howie Dewitt or Dewey? I would think, there's so many opportunities. You've been an RN for 17 years and you want to change and you feel lost. What about a remote job, Howie? How about that? What about a remote job? Something that you can still use your license for, but it doesn't involve patient care. And you can sit at home with no pants on and be in a work meeting at 10 o'clock or at 9 or 10 o'clock, getting paid for it, getting paid $40,000 more than you make for you to sit at home. Essentially a work from anywhere job. Go sit your ass and go to Hawaii and sit on the beach or sit in your hotel room and work for 8 hours a day or wherever the hell you are, and then go and then go to the beach or do it at the beach. Do whatever you want. correct at home triage nurse. Right? I'm trying to tell you, just because you're an RN doesn't mean bedside. I'm telling you right now. Travel nursing, you can do that too, right? But if you're tired of nursing, like, bedside nursing in general, go work for an insurance company like Aetna and do like utilization nursing, right? Get down into a routine, making $90 to $100,000 a year, working Monday through Friday for 8 hours or whatever. You see what I'm saying? I know there are so many options. I'm waiting to travel. Both my kids are teens, and as soon as I got you, you're waiting for the kids to essentially kind of be out of the house, so you can go travel, and they're kind of doing the thing. I understand that, but why wait? Why wait? You're tired. Why wait? Because you're gonna keep waiting. You're gonna keep being tired. You're gonna continuously bring all of that negativity of how you feel from work to home. And if people haven't already feel it, they're probably feeling it now. So why not? Why not leave? Like, here's the thing. Is one thing one of my mentors always told me. He was just like, take action. Like, if you have a problem, take action. Because the longer you let it linger, the longer that you're gonna suffer. Remember, we got the only motherfucking thing we don't have that we can't replenish is time. So find something different. Do it, and do it now. Because guess what? You can find something different, do a travel nurse job, and then imagine if you got an RV and you decided to go up to like Yosemite National Park. I'm sorry, Yosemite. Hey, don't judge me, okay? Y'all got an RV. You took your husband and your kids, and y'all went up there and y'all hung out and y'all camped all summer, and all you did is work from your fucking computer out in the middle of some campground. You could do that now. You can do that shit right fucking now. Instead of you wanting to wait until your kids are gone. When is your happiness gonna matter? It matters. It mattered yesterday and the day before, right? Thank you for sharing these conversations. They are important. Hawaii near a base offers $3,800 a week a few years ago. So one of my buddies just moved to Hawaii, and he's a first assist, he's a licensed surgical assistant, and he just moved to Hawaii, like back in like the end of September. I'm going to go for nursing. I'm scared, but I want this. Okay. If you're scared, go to church. That's what I say all the time. If you're scared, go to church. It's okay. It's okay for you to be nervous about it. The one thing I'm going to tell you right now is you need to time management, because your first semester of nursing school is going to humble you very, very much so. Okay. So I'm telling you right now, time management, you better start cutting people off. And I'm telling you right now, you're really going to know who your real friends are. You're really going to know who your real friends are when you start nursing school. You're going to know who's really supportive and who really has your back when you start nursing school. I'm telling you right now. All right. I literally said I was going to get off like an hour ago, and y'all held me hostage. Every single one of y'all. Barb asking me questions. Trace over here asking me questions. Veronica just like, yeah, I know all about that parking garage and walking through that long ass tunnel. Like, y'all kept me hostage. I don't like that. But your second semester is going to scare the shit out of you. Yeah, it is. Yeah, it is, because it's when you get into med surge. Right? So, but once again, I think I am going to get off, because I don't know if you guys heard my son in there, because he's in there talking. He's 19 months and he runs the house. I don't got no say so. I pay all the bills and he tells me what to do. What kind of shit is that? What's so bad about med surge? There's nothing bad about med surge. Med surge is a specialty. I'm not saying everybody, but med surge is a specialty. Barbara, you're welcome. But med surge is most definitely a specialty. Old school nursing tells you to go there to get your time management, but it doesn't matter what part of nursing that you go to. Time management is always going to be a factor. If you go to fucking the cath lab, factor. Peds, factor. OR, factor. People are like, you're going to lose your nursing skills. Okay, the more you fucking climb up the nursing food chain, you're going to lose those fucking skills too. Make it make sense. You know what I'm saying? AAA little ones. Right? Last question, please. Okay. Gabriella, you ain't even asked no question. What you mean last question? Where would you say you should work first as a new nurse? Gabrielle, go where you want. It does not matter it does not matter. You can go where you want. Go to where your heart desires. Do you want to go to med surg? Cool. Do you want to go to ICU? Cool. But you got to realize where these places that you want to go to first, you better do a lot of research and you better be prepared, especially if you're going to go to the ICU or if you're going to go to the ER. Shit moves fast. They move very fast. If it was mine, and this is being very biased, I have worked in the surgical realm for 13 years as a surg tech and as an OR nurse. You know what I mean? So I'll tell you, hey, go to the OR or go to the PACU. That's what I would tell you. Go to the OR, go to the PACU. But you go to where you want. What's your end goal? Do you want to be a nurse practitioner? Do you want to be an acute care nurse practitioner? Do you want to be a CRNA? Do you want to do flight? Do you want to do education? Do you want to do nurse leadership? Like, what do you want? You know what I'm saying? I love I'm not even gonna lie. The PACU is the holy fucking grail of all of nursing. If you're going to be working in a hospital, in my opinion. Holy grail. Next up to that would be the OR. I'm telling you right now, my opinion. The 12-hour shifts were like lasting 14 years. I was a zombie. Do your research. Facts. Do your research. How many hours do you suggest studying weekly? I don't know. It all just depends on you. That's a very variable thing. Mini ICU, the PACU. I love the PACU, and I think I love the PACU just for the simple fact that I did work in the ICU. Maybe that's why. But you can pick up very fast. Biggest thing in the PACU that y'all need to realize, Barbara, you already know this, is airway management. But you all, at least for the most part during the day, you have everyone there. Other nurses, the doctors are right there in the next hallway over in the OR or in pre-op, or you're fucking oh man, I just lost my train of thought. But you picking up what I'm putting down. So Missy, and to answer your question, it all just depends. I don't know what you're studying, so I can't really give you an answer. How many nurses that just want the money? Too many nurses just want the money, and then you have real nurses. You're right. You got to think a lot of nurses do want the money, but it wouldn't be that way if the system of these hospitals would treat the nurses better. Then they wouldn't have this problem. You know why PACU they asleep? Facts. You want to know why in the OR? Because they asleep. Oh. What is it? A student studies at least 20 hours per week and depends on info retention. So they study at least 20 hours a week. So if that's the bare minimum, you could be studying 40 hours a week. It all just depends on what type of learner you are and how you retain the information. What type of learner you are, how the information is delivered to you, and then how you retain it. PACU, they are crying and whining. Yeah, I've had some flip out on me, and I actually used guided imagery. And I was just like, hey, buddy, like, hey. And then the anesthesia was just like, bro, you should do like ASMR. Like, you're really, really good. I'm like, no. But after I graduate, where do you suggest I start to work? Nina, go to where you want. And if you don't know where to go to med-surg. If you don't know where you want to go to med-surg. So would you recommend going straight to the OR after graduation? Yes, get into a OR residency program. Get into an OR residency program. Nina, you're welcome. But like I said, if you don't know where you want to go to med-surg. But if you know you want to try to go to peds, go to peds. If you want to go to the OR, go to the OR. You want to go to the ER or ICU, get into their residency programs and go straight there. Go straight. Do not pass go. Do not collect $200. I'm just saying. So, but all right, y'all. I've been on here for like long time talking to y'all, kicking the shit. I appreciate y'all. At peak, we had like 500 plus people in here. It was awesome. So, one little shameless plug. Don't forget, 7-day NCLEX course on Black Friday. It is going away. Right now, it is $48. Once you get it forever. And I'm updating it like with content and a review. I like Monopoly. Monopoly is a good game. So make sure you guys go over there and check that out. Share it with people. Let them know that it's there, because on Black Friday, it's going away. It's going from not $48, and it's going from going away forever. So just letting y'all know. Also, if you need coaching, one-on-one coaching or mentoring or tutoring, anything like that. 7-day. I do NCLEX tutoring as well. You can check both of those links out for my tutoring and for the 7-day NCLEX course. Inside of the link is in my bio. It'll take you to a link tree, and it's the top two. Thanks for the book recommendation, Trace. You are very welcome. The what? Which one? Veronica, what you talking about? I'm lost. And then the last thing I'll say to you: take care of yourself, love yourself, be kind to yourself. There's only one you. I'm telling you, there's only one you. Right? These hospitals don't give a fuck about you. I promise you, they don't care about you. So take care of you, because if you can't take care of you, you're no good to no patient. You're no good to no spouse. You're no good to them kids. You don't know why? Because fuck them kids. I'm just playing. I'm just joking. Because I love mine. Okay. But seriously, take care of you, because if you can't take care of you, you can't take care of nobody else. And you're no good to no patient. You're no good to no, you're no good to nothing like that. All right. Veronica, what did you ask me? Oh, the NCLEX thing. Oh, the 7-day NCLEX course. It is in the link in my bio, and it's for $48, and it's going away. That's what I'm saying. It's going away on Black Friday. Black Friday, there will be another deal there, and it won't be the one that you see right now. So make sure you guys go over there and check that out. Tell everybody about it. They do not. Be smarter than the ball. Night. All right, Trace, I appreciate you. He's hyper. He's hyper. Yeah, that's good, right? Okay, thank you. You're welcome. Wow, you do a lot. And family, thanks. You're welcome. Appreciate you, TJ, for being here. But like I said, love y'all. I appreciate y'all. I appreciate everybody that was here. And I will see all of you guys on Monday, 5:30 Central Standard Time, because it's Texas time, and that's the only time that matters. So until then, I will see you guys later. Bye.